بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد.
And now if you could all please stand for the national anthem. Yes, hello and welcome. It really does give me great pleasure to see so many of us gathered here in the hall today for this 7th Pakistan Pharma Summit. And of course, the awards as well. And it's hosted by the Pakistan Pharmaceutical Manufacturers Association. Now, I'm just going to take the moment to introduce myself. My name is Georgia Tolley, and I'm going to be your MC for the day. Now, this prestigious event clearly illustrates the ambitions of the pharmaceutical industry right here in Pakistan. It's a sector that is seeking to evolve, but it does still face some local and international challenges. And that is why events like this are so important. They foster that environment of development, progress, and continuous learning. And I know I am looking forward to learning a huge amount about the pharmaceutical industry in the next few hours. Now, this year's event, it is the 7th iterate of this event, is going to be focused around the topic digital pharma transformation, enhancing efficiency in uncertain terms. And over the course of this morning, our speakers are going to aim to explore those technological advancements. They're going to consider the critical need for collaboration, improved regulation, and of course that all-important innovation. All of those needed to encourage the industry to thrive in the future. Now, personally, as I mentioned, I'm very excited to learn more. This is my second time in Pakistan, but it's my first time in Islamabad, and I'm very excited to get to know the city. I'm very excited over the course of the day to get to know all of you. And I'd like to start by thanking the people that made this event possible. Our presenting partner, Hilton Pharma, our platinum partners, Medisure, OBS, Farm Evo, and of course all of our other essential, really valued sponsors. They are the people who've made this event possible. Furthermore, I'd like to thank our esteemed guests, many of whom I've already met this morning. We're delighted to have you all here with us today. And also the organizers of this event, TerraBiz, and of course everyone here in this audience. Thank you for taking the time to come here and to make this event the collaborative and constructive, strategic event that it's going to be. We have this wonderful group of honored guests who have been kind enough to join us, and I'm actually going to invite several of them to join me on the stage today to sort of oversee the beginning of proceedings. So I'm going to read out the names of our guests, and I'd be delighted if those gentlemen could take the time to join me on the stage in the next few minutes. I'm going to come and stand over here so I don't get in the way. But first of all, our guest of honor, Dr. Malak Mukhtar Bharat, who is coordinator to the Prime Minister of Health. Sir, if you'd like to join us on the stage, that would be amazing. Thank you very much. Closely followed, thank you very much. Yes. A round of applause, sir. Thank you very much. Also, Dr. Mahmood Khan, who is CEO of the Hevolution Foundation in Saudi Arabia. Sir, thank you very much indeed for joining us as well. Of course, Dr. Khan is going to be making several addresses to our audience. Mr. Khalid Misbah, Chairman of the PPMA, thank you very much, sir. And we also have Dr. Kaiser Waheed, who is Chairman of the Summit Organizing Committee, a key figure, and also Mr. Haroon Kasim, who's co-chairman of the Summit Organizing Committee. Thank you very much indeed, gentlemen, if you'd like to join us as well. Thank you. No, I don't have a seat, actually. I'm going to be standing up the whole time. We also have Mr. Isra Sharif, who's Senior Vice Chairman of the PPMA. Sir, thank you very much indeed. And Dr. Marwash Khan, another Vice President of the PPMA. Thank you very much indeed, Dr. Khan, for joining us. And now we're going to actually move swiftly on to our opening remarks, and I'd like to invite Mian Khalid Misbah, Chairman, of course, of the Pakistan Pharmaceutical Manufacturers Association and Director of Popular Chemical Works, to take to the podium, sir. Thank you very much indeed.
Thank you, Georgia, for the kind remarks. Respected guests, distinguished speakers, honorable colleagues of PPMA, esteemed members of the press, our chief guest, Dr. Mukhtar Bharat, Dr. Mahmood Tufail, Assalamu alaikum and a good morning to you all. It is a great pleasure as Chairman PPMA and a privilege, of course, to welcome all of you to the 7th Pakistan Pharma Summit and the Pharma Export Awards, which accompany this event in our beautiful capital city of Islamabad. Pakistan Pharmaceutical Manufacturers Association, or PPMA, began its journey in 1961 and with a handful of people, and is the only recognized trade body representing the pharma sector in the country, with over 250 members across all the major cities and across the country. We comprise a mixture of national as well as multinational companies, and our mission is simple: to provide and ensure the availability of quality medicines at competitive prices for the citizens of our beloved nation, while also striving to enhance pharmaceutical exports. As we are aware that the Pharma Export Summit is linked towards exports, so that's one of the major themes of today also. It is a source of great pride for the domestic pharmaceutical industry that we are fulfilling more than 90% of our needs of domestic medicines through local manufacturing. This ensures that the industry plays a vital role in introducing novel therapies and treatments to improve patients' quality of life, a responsibility that became increasingly critical during the crises like the COVID-19 pandemic, the devastating earthquake of 2005, and the recent unfortunate floods of 2022. The domestic pharmaceutical manufacturing industry of Pakistan has made remarkable progress, significantly contributing to the national economy, and has become an integral part of the public healthcare sector. With the global pharmaceutical market estimated at US $1.6 trillion in 2023, we must look beyond our borders and compete on the international stage. Despite economic challenges in our country, we are committed to achieving US $3 billion in exports within the next 5 years in this sector, and I believe all of us here are a testament to that challenge that we have taken up with the support of the federal government, and we hope to achieve it and surpass it in the times to come. It is a great source of encouragement for the industry that year-on-year growth of the pharmaceutical exports has been 24%. This major achievement can be largely attributed to the decision of the federal government, along with, of course, the allied Ministry of National Health Services and the Drug Regulatory Authority of Pakistan, to deregulate the pricing of drugs which are not part of the WHO, World Health Organization's essential drug list. We are thankful to all the government departments, especially Dr. Mukhtar Bharat, who is present here with us today in making this possible. because the industry was struggling for survival. And this has provided the space for the industry to enable a positive transformation within this sector. It's a fundamental positive shift in the pharmaceutical sector of Pakistan and has not only ensured the availability of critical drugs that had vanished from the market due to historical devaluation of the Pakistani rupee and the consistently very high inflation that we have been facing. It has also reignited investment in the sector for domestic manufacturing of drugs and also the active pharmaceutical ingredients or raw materials as we call them. And I think it has provided the space for the industry, as we were just talking earlier, to invest into research and find out new avenues that we can attract investment not only in Pakistan in this field, but also start developing some of our own molecules and formulations and become part of the huge pharmaceutical market that exists beyond our border. Today, here we are, and we all have the unique opportunity to learn from industry leaders and opinion makers about the cutting-edge technologies and innovations in this sector, as well as learning strategies for navigating the complex regulatory landscape that the world presents us today. Dr. Mahmood Khan, Mr. Dennis Hall, Dr. Sami Kumlok, and Ms. Binar, we look forward to hearing your words of wisdom and insights to guide us in adopting modern technologies for betterment of our industry and our country in this critical sector and in these uncertain times. We will also recognize and celebrate the achievements of the top 50 exporters in the pharmaceutical industry, encouraging others to follow their exemplary lead and establish Pakistan as a formidable player in the global pharmaceutical market in the years to come. I firmly believe that under the able guidance of our current Honorable Prime Minister, Mia Muhammad Shahbaz Sharif, the federal government will continue its commendable efforts in the health sector of Pakistan, especially the pharmaceutical sector. I believe it is a matter of national security to have a robust domestic manufacturing sector in this industry, and PPMA eagerly looks forward to continued support of Dr. Mukhtar Bharat, our Honorable Coordinator to the PM on Health, Mr. Jam Kamal Khan, who will be joining us later, the Federal Minister of Commerce, as we strive to realize the vision of an export-led pharmaceutical industry. That will only be possible when we have a stable, robust, and growing domestic pharma sector, paving the way for increasing exports, earning the much-needed foreign exchange that we require for our country. We also hope for an immediate and the earliest possible positive conclusion to the long-awaited proposed amendments to the Drug Act 1976. I usually joke around with people that I am 47 years old, the Drug Act is 48 years old, so we look forward to a able conclusion and change before it reaches its half century of existence. And the support of, we have been very thankful to the support provided in our meetings by the Deputy Prime Minister, Mr. Ishaq Dar, the Honorable Speaker of National Assembly, Sardar Ayaz Sadiq Saab, as well as the Chairman Senate, Sayyid Yusuf Gilani Saab, who all understood the problems underlying the growth or the challenges in this sector, and based on the international best practices, how best to go forward with them. Talking about today's event, it's, I think, a testament to the potential of Pakistan's pharma industry. We stand ready to make significant strides in the international pharmaceutical market and compete with our other South Asian countries. The benefits of the drug pricing policy 2018, which was also the same political party which was in government at that time, has become evident with an increasing number of domestic manufacturers achieving WHO as well as PICS approval status. This is the first time that we have a number of countries in Pakistan in the last few years that have achieved this status. Before 2018, it was something that we could only dream of. The introduction of the API policy in 2022 is also making an impact, and in the times to come will reduce our reliance on the imported raw materials. All our member companies, many of whom are present here, are moving forward with a positive mindset, ready to navigate the uncertain landscape and embrace the challenges along the way. We look to the government and the allied departments as vital partners in this journey of discovery, evolution, and growth. Thank you for joining us today and helping make this event a remarkable success once again. This event is the result of the tireless efforts of the PESA Organization Committee. Many of hard work goes into that, long hours go into that, and two of our esteemed colleagues are present here, Mr. Haroon Qasim and Dr. Kaisar Waheed, whose efforts and tireless work has made this possible for the 7th time around. We are also thankful to our partners, TerraBiz, and our generous sponsors whose names were read out initially and also displayed around the venue. Let us all strive to elevate Pakistan pharmaceutical industry to new heights And I'm also thankful to our esteemed presenter. She's wearing a red color, which sort of adds to the black and white we all are wearing. And we hope for a great event today. And thank you for your participation. And let's all work together to make this industry one of the hallmarks for Pakistan in the times to come. And with these words, once again, thank our guest of honor, Dr. Mukhtar Bharat, for his presence in time, and hope that we learn something out of this event to make a positive contribution to Pakistan. Thank you very much.
Thank you very much indeed, sir. I appreciate those comments. And very interesting for me as a newbie to this topic to learn so much so quickly. That target of $3 billion of exports, of course, an ambitious one, but certainly, hopefully, as a consequence of this event, possible. Now, it is time for me to get a bit of an introduction, or for us to get a bit of an introduction to this summit. And to that end, I'd like to invite Dr. Kaiser Waheed, Chairman, as we've just heard, of course, of the Summit Organizing Committee, well known to all of you, and President and CEO of Medisure Laboratories, to take to the podium, sir. Thank you.
Assalamu alaikum and a very good morning. Indeed, it's an honor, a pleasure to be here in this August gathering. I must welcome all the dignitaries who have traveled from abroad. Dr. Mahmood, Danis, Pinar, Sami have come. And my special thanks to our honorable chief guest, Dr. Mukhtar, for sparing time, early hours of the morning, to be part of this August gathering. What was our intention to hold this kind of event, which is an investment intensive, lot of effort by requesting foreign dignitaries to come to Pakistan and enlighten us with their vision, with their understanding and their experience and expertise in their respective field, to enable our pharma industry, our entrepreneurs, our professionals to update their knowledge so that the ultimate beneficiary, the patient, should get the best medicine. Why we have choose AI, digital transformation, Pharma 4.0? Why? World is changing ever fast. वो क्या कहते हैं, आंख झपकते ही दुनिया बदल गई. This transformation we need to adapt. And this AI of the current era, the ChatGPT, is not the end. The next level with the advent of supercomputer is XAI. Expandable, interpretable kind of AI will be evolving, which are far different than what we are experiencing today. So if we don't adapt technologies of the era, the fourth revolution which we are experiencing today will be left behind. The world is going very fast pace. We are lacking in many things, but as PPMA, our honorable chairman, Mr. Khalid, has already dwelled upon this subject, and honorable speakers who have traveled from far-flung countries, from USA, from Turkey, from UAE, from Saudi Arabia, to enlighten us and our August gathering here, what they feel, how we can transform our pharma industry in Pakistan. I just want to take one benefit out of this opportunity which is given to me today. Unfortunately, are one thing, there is a subject called controlled drugs. In the world, Schedule 4 controlled drugs are not controlled by narcotic control ministry or whatever. I humbly request the Honorable Advisor to the Prime Minister, Coordinator to Prime Minister on Health, to look into it, to ensure, unfortunately, our regulators abdicate their mandate, to some other ministry, some other department, who are unable to understand the intricacies of medical science, drug delivery system, availability of the medicine, ensuring that life-saving medicine are available to the ailing humanity. They are unavailable. They cannot understand. And we have abdicated our mandate. And I'll request to the Honorable Minister, Honorable Coordinator to Prime Minister on Health, please ensure that the mandate given to DRAP must be retained with the DRAP. They should not abdicate their mandate to some other department or whatever that may be. At the end, I must, this whole day, you will be bombarded with the knowledge on technology. Grasp it, learn it, and then adopt it. Thank you all. Thank you very much.
Sir, thank you very much indeed. A very rousing call to action for all of us there, and absolutely fascinating to hear how technology really needs to be placed at the very sort of center of this innovation, I suppose not just for the pharma industry, but for every industry. Right, it is now, gives me great pleasure to welcome to our podium, I suppose in many ways, one of our guests of honor for his inaugural keynote speech, Dr. Mehmed Khan. Sir, I think we're going to go with Dr. Mehmed Khan, sir, who is the CEO of the Evolution Foundation in Saudi Arabia. Now, I'm going to give, I hope you'll allow me just a few minutes, sir, because I do want to introduce you. First of all, I just want to make it clear that we're hugely privileged to have Dr. Khan here with us. He really is a true visionary in the field of healthcare and health span. His distinguished career expands and includes many C-suite roles for companies, multinationals such as PepsiCo and, of course, Takeda Pharmaceuticals. But he's also had extensive on-the-ground experience serving as director at the Mayo Clinic in their diabetes, endocrine and nutritional trials unit. So it really is a privilege to have you here in Islamabad, sir. Dr. Mahmood Khan, the stage is yours. Thank you.
Thank you. Assalamu alaikum. And I'm glad I'm not doing the policy talk. So the easier part is the science, but happy to change sequence anytime. It's a pleasure, and I want to thank the organizers, Mr. Chairman, special friend, Usman, who played an important role in me making sure I was here on time and arrived. It's been a long time since I was in Islamabad. It's great to be back. My comments I'm going to divide into two, maybe three parts. I've had, as you just heard, 3 careers: academic physician and faculty, industry, and now running the second largest healthcare funding agency as a philanthropy in the world, second only to the Wellcome Trust. And as we look at this, we look at not only where the pharma industry is going, but the pipeline of innovation for the entire healthcare industry. And pharmaceutical industry plays a very key role in that, and I'll touch on that. I want to congratulate the members of this organization and this audience on the progress that's been made since the foundation of this country. Let us remind ourselves that when Pakistan was founded, there was no pharmaceutical industry. So while we have great aspirations for what the future might look like, it's always good to recognize the progress we've made from a nascent country that had no inherent capabilities to today, 70% of the drugs supplied in this country are by domestic pharmaceutical manufacturers. That is a huge progress. So the question not is to be complacent on that success, but to look to the future and say, how do we continue to be successful? We can celebrate the fact that there's maybe 20–30% of the local drugs available are multinationals. I would almost challenge you and say maybe that's a little too low. Why is it that multinationals haven't remained active in the market? We have to ask ourselves that. Because if you want a vibrant market, you need a market that exchanges ideas, exchanges talent, talent moves between institutions, and that international know-how enriches the local know-how. When you have an absence of that capability because of the absence of those players, you lose that opportunity. So it does behoove us to say, not that there should only be multinationals, but what is that right balance for Pakistan? And what are the incentives to create that? Because it isn't just the fact that they commercialize drugs in this market, but they bring valuable insight, know-how, and talent is developed from the young talent that leaves academic institutions, and often their careers are started because of the rigor they learn within large multinationals that bring this very diverse experience. And there are many examples of that, and many of you started your careers that way. So the question really is, what about the next generation? How are they going to be replacing that capability that takes a village to develop a CEO? You do not develop a CEO in a small environment. A global CEO is developed by a very large village, I can assure you, having been a CEO now 3 times. And it is not one person doing. So we have to ask ourselves that question. I congratulate you for the success of exporting to 60 to 70 countries now, getting accreditation from international agencies. All these are pluses and wins. And yet, for a country of 250 million people, a domestic market, pharma, of 3 billion is way too small. One really has to ask ourselves, for 250 million people, why is the market only 3 billion? And what are the barriers? Because if we don't understand the barriers, we cannot bring about change. And some of them have been touched on, and I'll come back to those. But what is the goal of this organization? And I had the privilege of learning last night from many of our colleagues who are here today about the industry and its progress. The goal of this industry in this country, like any other country, is to serve the citizens, provide life-saving, valuable, innovative, reliable, predictable therapeutics and diagnostics in the market at an affordable and accessible price. Much of that you're doing. The question is, will you keep up with the future of this industry as it transforms? And let's take a look at what is happening around the world. Now, in order to do that, we often use a word, innovation. It is a way overused word, in my opinion, because what we really need to think about is, what is innovation? Innovation is the translation, and this is my perspective, of taking an invention and transforming it into an innovation. There is an important distinction between inventing and innovating. Inventions are things that happen predominantly in advanced academic research centers, national laboratories, large institutions that develop the novel new pathways, molecules, receptors, all of those things. And I'll use a commonly used example, the COVID vaccine. We all are familiar. Probably everybody in this room took it. Most people don't realize that it took 10 to 15 years of invention in US national laboratories and the US NIH to develop the platform that enabled the world to take that invention and make it into a vaccine in 1 year. That was the innovation. Without the invention, there was no innovation. Let us not forget that. And I can give you drug after drug after drug. It took somebody to discover the HMG-CoA reductase enzyme before there was a statin. The statin was a consequence of the learning of that enzyme's existence and its role. Without the enzyme, there was no drug. And so that partnership in society between the different sectors, which is the academic sector, the public sector, and the private sector, which includes not only manufacturing, but the finance sector, is a collaboration that enables this industry to continue the pipeline. And so therefore we have to ask ourselves, what are the pieces we have and what are the pieces missing? And if they're not existing, doesn't mean to say you sit back and say, well, we don't have the resources to build those. The question is, what can you beg, borrow, and steal? What can you actually partner with to enable you to leverage what already exists? And if you have the capabilities to do that leverage, you can succeed. And so the question then that raises for the industry is, do we have that capability? Because it starts with the ability to collaborate. Not just collaborate internationally, but collaborate within your own organizations and between yourselves. So one of the questions I was asking myself last night is how much collaboration is going on between the 250 pharmaceutical companies that exist in Pakistan? Because that was a new learning for me. I was really surprised to learn how many there are. And then I thought about it, and it's actually not surprising. Any time there's a vacuum when international companies left, Pakistan is full of great, smart entrepreneurs. And they looked at the opportunity, and they took that opportunity and said, we can fill that gap. Congratulations. The next phase is going to be, in that S-curve, is how do you now develop the scale to actually now reach the impact that you desire. And that will happen either through consolidation, which has happened around the world. Let's take a look at it. The United Kingdom, with a GDP significantly larger than this country, has 2 major pharmaceutical companies. Not 200, has 2. The United States has about 10 which dominate, and Europe has 3 to 4. Japan, 3 or 4. So the real question is, what is going to be the future of the industry in this country? Will it be 250? Will they consolidate? Or will you collaborate in order to create the next key requirement, which is leverage? You cannot have leverage without collaboration. You cannot have leverage with your own government. You cannot have leverage with the market, retailers, distributors, nor can you have leverage on the international market, which you aspire to export to. Because in the absence of leverage, you do not have the next thing, which is scale. The challenge is, without scale, you cannot sit at the table and negotiate. And this is something that is being realized around the world, and I'll talk about the Middle East in a minute. If we really think about what COVID taught us for this industry, it wasn't the vaccine. It was the fact that suddenly leaders and policymakers woke up and realized in the entire Gulf, in the GCC, they ran out of paracetamol. The GCC ran out of paracetamol. There was not enough available because the entire world's supply was being used to treat fevers in their home countries. What do you think leaders are going to do when they see that? We ran out of IV fluids. In the United States, there was no antiseptics available. Why? Because the supply chains had been fragmented as a result of efficiency. Now that's an opportunity, because when you have such consolidation, it's gone too far. And so governments around the world have now woken up and said, we need, at a minimum, regional supply chains, we need regional security for not only key parts of society such as defense and education, but we need local supply of this industry. So that, not if, but when the next health crisis comes, we will have the ability to serve our own citizens. As a result, the entire GCC, for example, is looking at this. European Union is setting up its own supply chains. North America is onshoring its supply chains again. That is going to continue to happen. So the question is not, can the Pakistani industry continue to do business on a past model of supplying generics where you have big players like India and China that already have massive shares of the market, and you want to take a small part of that pie, which is going to change now because the rules are changing, or are you going to create a new role in this new changing world? And that's a question that you have to ask yourselves as leaders. And therefore, how are you going to do it? And I'll touch on that as I move on. I was asked to give a very broad mandate. I'm going to touch on several topics. Now I have to be careful because Faisal is going to do a fireside with me, and I want to be careful he doesn't ask me tough questions, so I have to be nice to him. Now, what will give you leverage other than scales? I mentioned leverage. I mentioned scale. The third is differentiation. If you have something that differentiates you at the marketplace, you have leverage. If you have a unique capability, unique technology, unique branding, reliability, confidence in your product on an international scale, not a local scale, then you have leverage. The challenge right now you have to ask yourselves is, what are the policy frameworks that level the playing field for this industry and give international markets confidence in your product and supply chain? For example, if you are making biosimilars, do you have a standard that is set for bioequivalence? Does it exist? And if you don't have bioequivalence within your own country, then how is another country going to rely on your product? It is not a level playing field. That is a policy framework that enables the industry to grow. So this is the partnership between policy, the public sector, and the private sector. It is not one or the other. It is not us and them. I had the chance and the privilege for 4 years to serve as chairman of the U.S. federal committee called the Committee on Advanced Technologies, overseeing the U.S. National Lab run by the U.S. Undersecretary of Commerce. Very few people realize it's a Pakistani who was the chairman of the U.S. Visiting Committee on Advanced Technologies, covering all industries, not just health. The fact that a civilian is overseeing a federal, U.S. federal national institution is testimony to the checks and balances between the private sector and the public sector. The U.S. is a great example. It is not the public sector versus the private sector. It is the private sector providing the oversight of the public sector because it is the public sector serves that private sector, not the other way around. We look at citizens being served by the public sector, not citizens serving the public sector. And therefore, policy frameworks come together. This is what makes the U.S. innovation ecosystem so powerful. So if we're going to look at benchmarks, we have to ask ourselves for this industry, how did we shape that? How is that done? Now, let me ask you, what are the key enablers? I mentioned one, which is the policy framework. I gave 2 examples. There are numerous others, and you know them better than I know them, for Pakistan. The second I'm compelled to touch on is human capital, talent. Pakistan produces some of the best talent in the world. Pakistani talent exists not only in the region, exists around the world. They now serve as mayors, heads of state, national leaders, industry leaders, CEOs, chairmen, you know it. That is Pakistani talent. The challenge is that Pakistani talent is rarely retained by Pakistan to the capacity that is needed. It is not that talent is absent in Pakistan, but too many of its best talent of our next generation leave. And so it is not my generation that's important in this. It is not. It is time for my generation to not only hand over, but we're in the phase of retirement. My colleague said he's 47. Well, in March I turned 67, young man. And so it is all relative. My point is that it is that next generation we have to nurture. And in nurturing that, we need to nurture them. We educate them in Pakistan, but somehow we do not keep them in the proportions that we need, and this industry needs them. Not just physicians. It needs scientists, it needs discovery, development, regulatory, all those capabilities, and it needs business executives. Well-trained business executives who have broad experience, not just from one company, but from multiple companies, because the strength of those executives is that nurturing and interchange of ideas. In fact, institutions that are developing their talent only vertically end up being weakened. Institutions that cross-fertilize, even between competitors, actually strengthen. If you look at any ecosystem where that happens. Now, let me talk a little bit from the structure, the challenges, to the opportunities for Pakistan. Pakistan cannot compete on price. Doesn't have the scale that India and China do. So let's not just try and compete on price. And by the way, competing on price is in essence a diminishing returns. One lowers the price, the other competitor lowers the price, and eventually you get to the point of barely making enough money that anybody survives. This has already happened in the United States, the UK, European Union. Almost all generic manufacturers have disappeared out of North America, Western Europe, and the UK. Why? Because they couldn't compete on price. Now, politicians are actually asking, was that a good thing? Should they have been protected given supply chains? A recent article just published last week has actually challenged that from, I think it was Brookings, that just published this paper a week ago. Read it. The US government is saying, no, let's onshore the generics. Is that an opportunity? Is that an opportunity for Asian generics manufacturers now to set up shop in the US and create a local supply chain? I'll defer that to you. But pricing is not a strategy. It's a short-term market share win. Innovation gives you pricing. So then the question really comes, what are the unique opportunities that Pakistan offers that the world needs? Not just what Pakistan needs, but what the world needs, and there are several. Number one, what COVID taught us, and COVID was not the first challenge. If you remember, those of you who are old enough, and most of you are, before COVID, there was MERS, and before MERS, there was SARS, and before that, we've had malaria, now we have dengue, and by the way, dengue has appeared in Texas. Not from immigrants, but local transmission of dengue. Dengue has appeared in the Gulf as local dengue. One thing I can guarantee you, when wealthy countries face a new health threat, the resources from the health department move in the direction to quell that. That is why the COVID vaccine was globalized, because it was a first world threat. Even if it didn't start there, the investment came massively out of North America and the US, and Europe. Similarly, the opportunity to develop diagnostics and therapeutics devices that are relevant to the world emanating from this country are a huge and unique differentiating opportunity. The question really for the industry and the country is, what are you going to do to take advantage of it? Not how many are you going to do, because it just takes one. You create the first win, not 10, create the first win, and that gives a center of gravity that becomes a catalyst for an ecosystem to develop around that win. So the question really is, how are you going to collaborate between public and private sector to find that opportunity and then leverage it? The second opportunity is the fact of multi-resistant organisms. Multi-resistant organisms now kill more people than cancer. Multi-resistant organisms kill more people than cancer. And yet, the research development dollars for cancer hugely outshadow what happens to microbiology. Let me give you an example. The US NIH research budget, the largest research funding, health funding agency in the world, NIH, is $44 billion last year. Just research. That is not the NSF, which is even bigger. That is NIH. That is not the national labs. The research health enterprise is probably in excess of 100 billion US dollars annually, not including industry. 44 billion is NIH. Of that 44 billion, 50% is cancer. And yet, the imminent threat is not just cancer, but what's coming is multi-resistant organisms, killing cancer patients, HIV patients, and I'll talk about the elderly in a minute. In order to really understand and develop those therapeutics, the US and the developed world and Europe and UK are going to have to come to developing countries to identify the strains, identify the genetics, test the therapeutic options, get the diagnostics. They have to be done here in some part or another. Question is, are you ready? Have you enabled yourselves to be ready for that opportunity because the funding will be there. It is not a question whether funders like myself and my organization is committed to funding about $1 billion a year. In the last 12 months, I've signed $400 million of contracts alone just with research academic laboratories. $400 million a year, just research. The funding is there. The question really is, which institutions and countries are fertile soil to receive that funding? It won't come just because you ask. It will come because you demonstrate the ability to leverage it, to utilize it, and convince funders like myself that we should invest in these institutions, starting with the academics, the intellectual horsepower, which will leverage that and then transform the industry. Now, let me finish and give you a little window into the future. I've talked about the country, I've talked about the current opportunities, but where's the world going to? And it is being enabled. What I'm about to share with you will sound sometimes scary. It is being enabled by two massive forces. One is technology, and within technology, two things. Number one, we now have the ability to understand life at a molecular level. No longer is the pharmaceutical industry an industry of chemistry. And I'm going to challenge you, provoke you, and ask yourselves, how much of your industry is based on chemistry? That is old world technology now. The vast majority of new drugs coming onto the market today are no longer chemistry-based. They were either discovered using biology, manufactured using biology. One of the first, remember, was insulin, which is no longer using animals or chemistry, it's using biology. And the new therapeutics directly interact with your human biology. So the question is, do you have the biologists, and do you have the biological labs, and do you have the biological capabilities and the biological manufacturing capacity to utilize this new frontier, or are we still living in chemistry? Chemistry is old world. The second breakthrough that's happening is the ability to take massive amounts of data that is generated by these biological systems and now understand it in ways that we never could because we have high-performance computing and mathematical algorithms using computational biology that did not exist. When I went to medical school, and even after that went to graduate school, unfortunately, in my generation, you chose in your career when you were 16 years old whether you did biology or mathematics. And you were either going to go to medical school and be a biologist or you're going to be a mathematician. At 16, you stopped learning mathematics because you're going to be, my putter doctor banega. Mathematics kya karni? Ya ye engineer banega. Isne biology kya karni? Unfortunately, in many countries today, while the world has moved on and there's no such thing as biology or mathematics, curriculum, unfortunately, even in this country today, still talk about biology versus mathematics. And yet, the modern biologists are microengineers, and some of the best engineers are studying the biology as the engineering of biology, because these disciplines have merged. And do we have the educational policies that enable a medical school to teach mathematics and an engineering school accreditation to teach biology? Unfortunately not. And that means the human talent that does not exist to write the research proposals and ideas for that future. Now let me leave you with where the world is now moving to. There are 1 billion people on the planet today that are over the age of 60. By the year 2050, there will be 2 billion people over the age of 60. 1 billion more. They will double the population of people over the age of 60. And the vast majority of drug utilization is in people above the age of 60. Because age-related diseases, diabetes, hypertension, cancer, cardiovascular disease, stroke, most of your customers are middle-aged and elderly. They're not young teenagers and 20-year-olds. unless they take a short-term antibiotic. They're people typically 40s, 50s, 60s, and 70s. It is for you young people, not you, but your parents' generation, that are the customers of your products. And that customer base is about to double. And most of that's going to happen in wealthy countries, which have the purchasing power and need to take care of those patients. Some countries, 70% of the deaths from COVID were people over the age of 60. The world stopped because of the elderly. 70% of the deaths were over the age of 60, and to protect their lives, society was shut down. That is the reality. Society will take care of that elderly population, not only for them, but also for the young population. And so the amount of investment that's going into the research on the biology of aging and how aging results in age-related diseases is now the center of gravity of biological research. Not what is commonly written about, which is how do we live longer. That is rubbish. That is media soundbite saying longevity field. There is no such thing. This is not the elixir of youth. What is really being tried to understand is what is it about time that results in biological processes that change your youthful biological functions to functions that decline in a way that gives you cancer because your immune system changes, gives you diabetes, gives you heart disease, gives you cardiovascular disease. And can therapeutics actually intervene in slowing that degradation down? In function, not time extension. That is the next major frontier, because the global demographic change that has happening across the world, Japan, China, South Korea, North Europe, United Kingdom, the US, all these countries are experiencing a massive change in their population, and that population votes to put resources behind the care that is needed for them. That is where this industry is now going. That is where massive amount of investment is happening. But the diagnostics, the therapeutics, all of them are based on biology, including the wonder drug that we now hear about, such as Ozempic and the GLP-1. These are biologics. They were developed using biological systems. And I'll leave you with a fact. Europe's most valuable company today is not an aircraft manufacturer, not an automotive industry, it is not an oil company, but it is a biologics company based on biology on one platform. And the investment it took, by the way, to develop GLP-1 was 25 years, not 2 years. 25 years ago, when I was a young graduate student, researchers started working on GLP-1. It manifested in the market the last decade and really took off the last 5. And look how biology is changing. It is changing the food industry. The market value of food industry has declined because of the US GLP-1, because consumption of many of those foods has changed. The market cap of many protein-based companies has gone up because of that. The market cap of healthcare suppliers and actual healthcare providers has come down because of utilization of those resources. Markets have shifted because of biology. So I hope I've given you enough to think about. I hope I've provoked you to not only look at the challenges, but look at also the potential opportunities. Again, I congratulate you for the progress you've made. I'm excited about the future. I think your industry is right at this inflection point, and you have some choices ahead. And those choices include not only investment of foreign capital, but developing your own human capital, making the policy frameworks that you need to enable your industry to grow, partnering with government in the right way, collaborating between yourselves to give you leverage and scale, and ultimately competing not on price, but on differentiated product and service, not just ready for today, but investing to be ready for the future. Because for our industry, I can assure you, just looking at the investments being made across the world, and now in my role, both in Boston and in Riyadh, the investments are very, very significant. The real question is not if, but will you be ready to leverage that opportunity? Thank you very much.
My goodness me, so I learned a huge amount from that, and what an exciting sort of breadth of ambition there for Pakistan's pharmaceutical industry. I'm already very impressed to hear that the industry here already exports to 60 to 70 countries, and I'm sure as a consequence of events like this, that can only increase. It is now time for me to welcome our chief guest to take to the podium for his words. We're going to be hearing now about the thoughts from the government, effectively. Dr. Malak Mukhtar Bharat, coordinator to the Prime Minister of Health. Thank you very much indeed, sir, for your time and for attending.
Bismillahir Rahmanir Rahim. Honorable Dr. Mahmood Khan Sahab, Khalid Misbah Sahab, President PPMA, esteemed guests, our honorable experts from abroad, ladies and gentlemen, Assalamu alaikum and good morning. It is my honor to address the pharmaceutical industry of Pakistan, which plays a critical role in the country's healthcare system and economy. Pharma industry of Pakistan has evolved significantly over the past few decades, contributing to local healthcare needs and economic development of Pakistan. Ladies and gentlemen, today's event is of great significance. This gathering not only highlights the remarkable advancements in our pharma sector, but also serves as a critical platform for dialogue on the challenges and opportunities that lie ahead. Over the past few years, significant strides were made in developing this sector. We have seen a marked increase in both local production and exports of pharmaceuticals. Around 90% of Pakistan's domestic needs are met by the local pharma industry, which is really very commendable. It provides employment to a great number of people in Pakistan, and sheer volume of this industry is in billions of dollars today. And as rightly said by Mahmood Khan, we need a lot of more investment in this industry, and we are very hopeful that we'll be getting, after this deregulation of the prices of this industry. Similarly, pharma exports have surged and an overall growth trajectory is observable. In my opinion, the major factors behind these achievements are, firstly, the Prime Minister is taking keen interest in developing this sector. Since day one, it has been his priority to implement supportive policies for achieving a sustainable model for pharma sector's growth. Our determination is clearly evident in the form of various initiatives taken by our government. Few of the important steps include improvement of overall governance for ensuring an investment conducive business climate and strengthening of Drug Regulatory Authority of Pakistan. Massive reforms have been undertaken by digitization of regulatory functions, reducing unnecessary requirements, adopting international standards, and increasing human resource capacity. The automation of licensing and registration procedures has resulted in streamlined and transparent operations, and the dependency of applications has been catered for. Supported by online system and requisite IT infrastructure, this digitization drive of draft will be completed soon, and the applicants will not face any delays for processing in their applications. We are also advertising more than 200 technical positions for DRAP so that more technical human resources available for smooth transition and functioning. There is also a debate going on the establishment of an independent pricing board at the government level. We are very hopeful that final decision in this regard would be soon made, which will help in resolving pendency cases on drug pricing. Despite these achievements, there are several challenges that persist. Both government and pharma sector want to achieve milestones in the development for the benefit of the people and the country. However, this cannot be done without realizing the urgent need for adopting international standards. In this context, I must commend the efforts of PPMA for supporting our policies. The association is welcoming our initiatives of implementing international standards such as bioequivalence and PIC standard GMP guidelines. Although bioequivalence has been implemented, the consultation process on PIC's GMP guidelines is also near to completion, and we are receiving positive response from the PPMA. The path forward is to create an ecosystem that nurtures innovation and drives sustainable growth. For this, our vision is clear. We aim to position Pakistan as a major producer of pharmaceutical and competitive player in development of other technologically advanced therapies. As a result of PM's efforts and in this regard, where he visited China, we are also receiving good news regarding the technology transfer to Pakistan from China. I won't take much of your time. There were two questions asked by me from the President and the PPMA. The first one was about the legislation, pending legislation. I must apprise the Honorable August Forum, this August Forum, that after the 18th Amendment, the drug regulation was also evolved to the provinces. Now, when we have to come up with some legislation in the Drug Act, we have to take on board the provinces. We are in the consultation and we are very hopeful that we'll be able to come up with a consensus document with the provinces, which will be very much acceptable to the pharma industry also, and very hopeful that it would be done within a month or so time that we'll present it in the National Assembly. And secondly, rightly said by our honorable friend, that the discrepancy regarding the controlled substances with the narcotics, we know we are very well aware of this discrepancy, and I think it's the right time to address this. We have written to the Council of Common Interest to participate in this dialogue between the narcotic industry and the health ministry, and we will appreciate your comments also to come up with a solution. And thirdly, I would like to apprise you or assure the pharma industry that my doors are open for you always. Either you want to come to your association, either you want to come and just walk into and I'm here to facilitate the industry. And I trust and I am very much confident that this industry can make a big difference in exporting, in the rise of our foreign currency accounts also. And I think pharma industry has now the right time to click off, to go to pass those barriers and come up with the new technologies and come up with the new medicines. And I think we are very much we are hearing very good news, as I must appreciate that one of our nutraceuticals has been approved by the FDA in recent months, and some of the things also by approved, these dengue diagnostic kits has also been approved by the UAE authorities, and other drug regulators around the world are approving our drugs, which is a very good news for the pharmaceutical industry. In the end, I am really thankful to the PPMA, to the organizers of this whole summit. I think this is a great place to sit and discuss what is the way forward. Thank you very much.
Dr. Malik Mukhtar Bharat, thank you very much indeed for those encouraging words. Very good to hear that pharma and the pharma sector are a priority for the Prime Minister. So thank you very much indeed for your time. Now, I know that all of us are here are hugely grateful to all of our esteemed speakers this morning, and we're also very grateful to all our sponsors. And as a consequence, we would like to just take the time now to award several mementos to everyone who has helped make this fantastic, prestigious event reality. So we're going to move into our awards ceremony for the next few minutes. I know I'm going to be joined on the stage with a bit of assistance, but first of all, I'd like to thank our guest of honor, our speaker just then, Dr. Malik Mukhtar Bharat. Thank you very much indeed, sir. And if we could award our mementos, that would be fantastic. Am I right in thinking that Dr. Khan is going to help award these? There we go. Thank you very much indeed, sir. And if we could just pose for a quick photograph, that would be wonderful. Thank you very much indeed. All of our esteemed guests, such valued contributions there, and certainly really framing the conversation here. Also, if we could have a memento for our guest of honor, Dr. Mahmood Khan. Thank you very much indeed. Thank you. There we go, amazing. And then we've also got, of course, our presenting partner, Mr. Shabaz Yassin Malik of Hilton Pharma. A memento for you as well, sir. Thank you very much indeed. There we go, thank you. Thank you very much indeed for joining us on the stage, sir. We also have, of course, our platinum partner, represented today by Dr. Kaiser Wahid of Medishore. So if he'd like to join us on the stage, sir, thank you very much indeed. And of course, our other platinum partner, valued Farm Evo, Mr. Haroon Kasim, is joining us from Farm Evo today. Thank you very much, sir, for your contributions and for your valued sponsorship of this event. And our third platinum partner, OBS. So if the representative from OBS would like to join us on the stage to receive his memento, thank you very much indeed, sir. Lovely to have you with us. Thank you. And then we have our gold partners, each and every one of them a valued contributor and sponsor to this event. So thank you very much to ATCO. If the representative from ATCO would like to join us on the stage, we have your memento for us here. Thank you very much indeed. Do we have our ATCO? Oh, here we go, sir. Thank you very much for joining us on the stage. Absolutely wonderful. Here we go. Thank you, sir. And our representative from CCL, who's joined us today. Thank you, sir, for joining us. I'm just about giving time for everyone to have a photograph. Thank you. Our photographers are working hard in front of us. Our representative here from CCL, thank you very much indeed, sir. Another one of our gold partners, of course, Genix. If there is a representative from Genix joining us on the stage. Thank you very much indeed. Oh, sorry, sir, you're here already. My apologies. Of course. A repositioning. And the representative from Halion, if you'd like to join us. Thank you very much indeed. Sorry, sir. Congratulations. Our representative from Helion joining us now to receive their memento. Thank you for your valued contribution to this event, sir. Another gold partner is Herbion. Thank you, sir. I can see you approaching the stage. An absolute pleasure to have you contribute, sir. And our next gold partner, while that photograph is High Noon. It's like being in front of the paparazzi, isn't it? Thank you very much. A good thing, the paparazzi. High Noon, the representative from High Noon, thank you so much for joining us on the stage. Thank you for your contribution to the success of this event. Martin Dow is our next gold sponsor. If the representative from Martin Dow would like to join us. Do we have a Martin Dow? If we don't, we can move on to Nabi Kasim. Sir, if you'd like to join us on stage for your memento, I can see you approaching. Thank you very much indeed. Thank you. Oh, okay, thank you, thank you. They'll arrive later. And our final gold partner is Searle. So thank you very much for our representative from Searle. If you'd like to join us on stage to receive your memento and have a quick photograph with our array of photographers that we have here. And then we'll move into our silver partners, each and every one of them valued contributors to this brilliant 7th Pharma Summit. Bosch, if there is a representative from Bosch, I know there is, if you'd like to join us. Gentlemen, thank you very much indeed for joining us on the stage. We have your memento here. Thank you very much, gentlemen. Here we go. And then Farm Asia will be our next silver partner who we would like to appreciate this morning. Quick photograph. Thank you, sir. Appreciate it. Our representative from Pharma Asia joining us on the stage now. And Shazoo is our next silver partner. So if we have a representative, sir, thank you very much indeed for joining us. Thank you for your contribution to the success of this event. Everyone is learning to smile a lot. Sante is our next silver partner, sir. Thank you very much indeed. People are anticipating my alphabetical sort of list now, which is brilliant. Thank you very much indeed, sir. Tabros is our next silver partner that we seek to appreciate. and thank for their contribution to this 7th Pakistan Pharma Summit. There we go. And of course, W Group will be our... Oh, I'm moving too quickly. I should slow down slightly now. Sorry. That's the problem. I get on a roll. So our representative from W Group, sir, next. Thank you very much indeed, sir, for joining us on the stage. And we've moved out of the alphabetical order now. We're moving now to Glitz Pharma. If our silver sponsor representative from Glitz Pharma would like to join us on the stage, we are ready with your memento, sir. Thank you very much indeed. And our final silver partner, it is our retail pharmacy partner, Green Pharmacy. Please do join us on the stage, and thank you for the key contribution you make to the pharma sector. Our representative from Green Pharmacy joining us on the stage now. Thank you very much indeed, sir. Huge thanks to all our esteemed and honoured guests for taking the time to do these photographs. So important to honour everyone who's helped make this event. Let's move to our exhibitors. Thank you to Delta. If our representative from Delta would like to join us, of course, I'm sure you've seen the displays of our exhibitors outside in the hall area. We also have HSA. They are also one of our exhibitors. If a representative from HSA would like to join us on stage, sir. I understand that some people might be manning their exhibits. So are you from HSA? Yes, sir. Thank you very much indeed for joining us. We'll make sure. And of course, Rifa University. We just heard about the importance, the need for bringing up this younger generation. And of course, our representative from Rifa University, playing a key role in that. So if you'd like to join us on the stage, thank you very much indeed. More academic partners. Again, you know, we did just hear about the need for bringing up the young people. Another key factor that dazzled me was the idea that, you know, the market was going to double as the elderly doubled, so was the market for you to export to. So our academic partner, Dow University, if we could have our representative and partner from Dow University join us on stage. I think potentially I can see a gentleman moving towards us. Is he from Dow University? He is indeed, sir. Thank you for your time. Thank you for your contribution. We also have, here we go. Oh, we've got two. Thank you very much indeed. Both individuals from Dow University there. Thank you very much indeed. Now, our second academic partner is PAF IAST. I hope I'm pronouncing that acronym correctly. Do we have a representative from that academic partner? I can see people moving around the hall. We do. Gentlemen, thank you so much for joining us on the stage. We really appreciate your contribution. And we're about to move on to, yes, our PR partner, also, of course, a valued contributor to the success of this event. You know, we need everyone to hear about it. And huge thanks goes to Naeem Qureshi from Publicity Channel. If you would like to join us on the stage, we would be most grateful to you, sir. If you'd like to come up to receive your memento, do we have Naeem on hand? Thank you very much indeed, sir. I see you moving towards us. Thank you, sir. And then, of course, hello there, Naeem, sir. Thank you very much indeed. And our final memento for the morning, and of course, huge thanks to the organisers of this event, Mr. Hamza Hashmi of TerraBiz. Thank you very much indeed, sir. Thank you.
Award recipients can collect their boxes from the site.
Now, everyone who's received their award, please do feel free to collect the box for that award, for that memento from the side here, so that you can ensure that it makes its way home safely. But I mean, it falls to me now to say thank you very much to all of you for joining us on stage, our honoured guests. If you'd like to take a seat amongst the audience, you can probably relax a bit more than on stage, but it has been an absolutely brilliant start to the morning, and thank you very much to everyone who has taken part. For everyone's participation, it already feels like this event has got off to a cracking start, and it is now time for us to take a quick tea and networking break. This is your chance to get to know each other, to collaborate, and I will ask for you to return to us at about 11 a.m. Oh, yes, of course, yes, absolutely. Just before everyone nips off for a cup of tea, or I suppose coffee, if you'd like to join us for a group photograph on stage, our eminent speakers, if you'd just like to do a quick photograph, that would be absolutely fantastic. Thank you very much indeed. One of those, a brilliant opportunity to get lots of people in the one picture. So yes, if you, Pinar, if you'd like to join on stage as well. So if you're going to be a speaker at the event today, if you could join us on stage for a quick photograph, I think it's quite a fun opportunity. We are all going to need to, if everyone could take a step closer to the person next to them, that would be fantastic. That might enable us to get everyone in the picture. I don't know, we'll see how our photographers are doing. Is it working, gentlemen? Big smiles. Wonderful. It's so good to see so many people pulling together, so many people drawing together, really indicative of the collaborative nature of this summit. So yes, ladies and gentlemen, please do enjoy your tea and coffee break, and if you could rejoin us at 11 o'clock, we will continue with our fascinating roster of events. roster of activities, starting with a fantastic fireside chat. So if you could make your way and take a seat, we will be starting within the next minute or so. Thank you, sir.
Speaking with Dr. Khan.
Yes.
In the fireside chat. Yeah, I'm Osman.
Thank you, Osman. I think these two. Let me double check. Are we going to remove the other chairs, or are we just leaving the
Remove the other chair will be a problem because the mics are already wired in.
mics are there? So in which case, I think we just take the first two. I think these two. Oh, completely up to you.
Corner one. Let's go with the corner.
Corner one?
Yeah.
Can I move this mic?
Strategically, it will be better on the camera.
So if you do this, and
We should move both the mics so that I'm
You
not looking away when I speak into the mic. And then
good point.
This mic. And this is
Okay.
you miss the camera will actually become better.
local Pharma Summit का नहीं आ रहा. Is that alright? If you want the Pharma Summit in the background.
That's not necessary. यहाँ भी आ रहे, वहाँ भी आ रहे. That's fine.
Thank you for checking, sir.
Video feed output है ना बड़ी वाली screen पे आ रहा होगा आप लोगों का.
Do we have Mr. Khan? Right, I did promise that we were going to start within the next minute, and I am afraid going to stay true to my word. I know it's always very difficult to pull people back, especially when you are doing exactly what this summit is designed for, which is to collaborate and to network. But we are going to be starting with our next agenda point, and I'm delighted to say that we are going to be introducing a fascinating fireside chat. So yes, if we're going to harness this lovely energy that I'm seeing out here in the audience, and we're going to harness it all the way through until lunch. So without further ado, let us press on with our first discussion, our first fireside chat. And I am delighted to welcome Dr. Mahmood Khan to the stage for a fireside chat with our moderator, Osman Khalid Walid, who is CEO of Ferrazan's Laboratory Limited. Now, we did hear earlier that Dr. Khan was hoping that Mr. Wahid was going to be kind during this conversation, so let's see how it goes. Thank you very much indeed. A round of applause, please, for our guest. Thank you very much indeed.
So this is a fireside chat, but the fire is in here, hopefully. I've had the privilege of knowing Dr. Mahmood Khan for over a decade. And even after 10 years, it's so daunting to sit next to this gentleman because he's not only worn many hats, in each of those hats, he's held the most coveted positions on a global scale. So as an academic, Dr. Khan was faculty member at the Mayo Clinic, Fellow of the Royal College of Physicians, Fellow of the American College of Endocrinology, elected Fellow at Oxford University in the Department of Pharmacology. In the private sector, he was Global President of Research and Development at Takeda, which is one of the world's most successful pharmaceutical companies. And at PepsiCo, he became Chief Scientific Officer and Vice Chair globally of one of the largest FMCG companies on the planet. We've also had the privilege of knowing each other from a different lens, which is
the more important,
which is LUMS, the university in Lahore that most of you hopefully will know. And at LUMS, I can personally attest to the difference Dr. Khan has made. Just the 15, 20-minute glimpse you saw of the expansive worldview this man has and his ability to articulate such large ideas in very small sentences. I think it blows me away every time, Dr. Khan. So what I wanted to start off with is perhaps an aspect of yours that we've not been able to cover in your talk, which is you as a person. So all of these achievements, each of which would make people very proud as Pakistanis or envious as colleagues, competitors, what has it been that's driven you to these heights and everything that you've tried in life? And what are the values that you've held dear that have sort of helped you not only remain grounded, but also help you build on each success and have a larger impact as you progress through your career?
Well, first of all, thank you for the kind introduction. As I said, Usman played an important part of my presence here today, so it should not be underestimated. If I look back, excuse me, at my 42-year career now, I'd start with, excuse me, if you were to come to my office, I have a little plaque on my desk in my office today, which is a quote from Michelangelo. And when Michelangelo, probably one of the greatest geniuses in the art world, created and had just finished David, he was asked how he imagined David in this block of marble. And his answer was, I'm still learning. And if Michelangelo, in his genius at the height of his career, considered himself as a student, the one thing that drives me is I'm still learning. And I consider myself was a student, and I'm still a student. And that ultimately is what keeps it going. There's one other thing I would say for the young people in this audience. Everybody will fail. Every single one of you will fail at some things that you do. Success will be determined not by the number of failures, but your ability to recover from them. You will face challenges, you will face prejudice, you will face biases in every way. But your resilience and your ability to overcome is what is the key. Fortunately, I don't have to list my failures on my resume because it would be a volume. It's just a small piece of paper because you only get to list your successes. That's the key. I hope that answers your question.
Yes, and you just reminded me of another person that we have in common, Sayyid Babar Ali, who at the age of 98 still continues to learn. In fact, his autobiography is called Learning from Others. And I think that's such an important message for us oldies, but also the young generation.
You're not old.
To really learn from. And you spoke a little bit about adversity and failure and the need to learn from failure. And I mentioned in the opening that you have not only succeeded in the areas that you've endeavored in, you've reached heights that other Pakistanis, in fact, even people from other nationalities have not. In the US, as a recognition of your contribution to science and the United States of America, in fact, as a country, you were awarded the Ellis Island Medal of Honor. And we often talk here in Pakistan or in the East about the scale of prejudice that exists and racism and all of these challenges. And I'm sure in your career, you had some unpleasant encounters with some of these challenges. And yet you got some of the most highest accolades that the US government could give to any of its citizens. And then subsequently, now more recently, Saudi Arabia has been one of the most closed countries traditionally. And yet here we have a Pakistani who is the first and only Pakistani to be awarded citizenship by the government of Saudi Arabia, again in recognition of your contribution. So just please expand a little bit about these two accolades and also the experiences that drove you through adversity.
Well, first of all, I think a learning mindset is a global mindset. I have the privilege of having 4 citizenships, the first of which was Pakistan. While I've not lived in this country, I will never stop being a Pakistani. And that is, if nothing else, the most important because it's my heritage. I don't consider Pakistan just as a citizen, it's a cultural identity. And that is my origin, and I think we need to be grounded and proud of that. But I'm just as proud to be American, British, and Saudi. And it's a privilege, and it's a recognition to be part of a community. It is a recognition to be able to participate and give forward. And I think that opportunity is what keeps people like myself, most of us, engaged. Now, yes, there's prejudice. I grew up in England. My father moved to England in the 1950s. I started kindergarten or nursery school in England in 1963. You can imagine the England of 1963. For Asian immigrants, a child growing up first in London and the north of England, before the civil rights movement had happened in the US. So I won't expand on it, but remember what we take for granted as civil rights today, when I was a child, were not civil rights. The British had just left Pakistan and India only 10 years previously. The teachers I had in school were teachers from the Raj. I was the first Asian child in my school district in 1963. And so, yes, there was prejudice, but that's okay. The question is not, is there not prejudice in Pakistan? I don't know a country where there's not prejudice. Our challenge is there's prejudice in Pakistan against Pakistanis. So who am I to question prejudice in another country? The issue is not that. The issue really for me, and the opportunity that made most of us who we are as immigrants, is the ability to get past that. Now my children and my grandchildren are much more privileged. You know, my grandchild, my grandson was recently had a chance to visit my old university where his grandfather had entered 50 years previously. And it was a proud moment for me to take my grandson. But it was a very different institution 50 years ago in a culture. But I'd like to think that others paved the way for us too. Each generation has opened the door for the next. I benefited from my father migrating. When he migrated, it was a greater challenge still. So I would say to every one of you, prejudice is part of society. Resilience is the important characteristic that will allow you to overcome it. The question is not, will there be prejudice? And the question is, will you be resilient to it? And society will give you the opportunity. Everywhere I've lived, United States, the UK, and Saudi Arabia, recognized excellence. I would like to think that was the more important factor.
That's really inspiring, thank you. And Dr. Khan, now moving to your latest incarnation, which is as head of the Hevolution Foundation. And as you mentioned, Hevolution gives out about $1 billion annually in grants, second only to the Wellcome Trust, and has a major impact on research and development in health. Yet, there's not a single Pakistani applicant for any of the grants that Hevolution has issued. So if we look at the healthcare landscape of Pakistan, we are home to some really depressing numbers, in a sense. We have 12 to 15 million people living with viral hepatitis. So we are the global capital of hepatitis C, the largest population in absolute numbers of any country of citizens living with hepatitis C. In diabetes, we recently were declared by the IDF a very dubious honor of having the highest prevalence on the globe in diabetes. So 30 million adult Pakistanis now live with diabetes. And AMR, you mentioned it in your talk as well. It's very likely that the next superbug will probably originate from Pakistan just because of the extensive overuse of antimicrobials that just takes place in this part of the world, India and Pakistan both. But that also means that the next super resistant bug will also be gestating here somewhere, and hopefully we'll find a solution to that. But what does this mean in terms of opportunity for Pakistani pharma and also for the Pakistani health system? So I would like you to give messages both to us as manufacturers as part of this ecosystem, but also to the public sector, to the government, to the Drug Regulatory Authority, and how we all can do our jobs better to make sure that we're prepared to meet these challenges and be part of the global solution.
So I touched on, and I'll elaborate a little bit further, but our industry, and I'm talking about the life sciences industry now, the life science industry has a value chain. The last point of that value chain is either the healthcare provider or the patient consumer themselves. If they do over the counter, they purchase it. But what we must never forget is that value chain extends all the way through to public health and policy, which is the framework that creates the areas of focus and investment. And private sector can never have the scale of investment that the public sector has. No one company is bigger than government. And I think sometimes we forget that as industry, but our job is not only to make ourselves successful, but to allow the government to give us the policy framework to enable us. And I touched on all of those things, and that's the key. Now, the global solution opportunity is the fact that, unfortunately, while we are the incubation ecosystem where multi-resistance is occurring, for all the reasons you mentioned, but in addition to behavioral issues, such as drug use, environment, sanitation, water, the presence of antibiotics in the water supply is an important contributor to multi-resistance. All of those things are incubating this resistance. That is now appearing in developed countries. And so the opportunity for Pakistanis, patients here, but also globally, is to understand not only the causative factors, but how do you get down to the molecular level of diagnosing that resistance, predicting it if possible, and I think it will be possible to predict, given the use of computational biology. Enabling prediction will actually allow you to generate waves of antibiotics, for example, before those resistance organisms appear, and you now start, because right now medical practice is a cocktail. Here's what happens in medical practice, no disrespect to my colleagues, but you read a journal, it says the first line antibiotics is the following, you give them 2, maybe you give them 3, if that doesn't work, or you get a culture and sensitivity, you try this one, and eventually hoping that one will work, either because of sensitivity analysis or it's ad hoc. That's about to change. We already have molecular fingerprinting. As that starts to happen, we'll be able to do predictive. That will allow the industry to actually be ahead, just like we predict future vaccine requirements. You know that from your company. And so that, once that starts to happen, can you imagine the collaboration? For example, telling country X in Europe of what the next wave of resistance is, so the supply chain can be developed ahead of the actual appearance of those antibiotics. That is the future. Not an in-time supply chain, but a predictive supply chain. We're still in a reactive supply chain, let alone in time. So these are examples of where industry can transform itself and yet be a service. What will that take? I mentioned the tools. How many pharma companies are starting to hire computational biologists to start to shore up? I can tell you in Europe and North America, one of the hottest hires are mathematicians and computational biologists. Why? That's where they're going.
No, that's exactly right. And I think predictive AI, unless you begin to at least understand this phenomenon in the pharmaceutical sector here, nascent as we are, I think we will miss yet another wave of growth that Pakistan could have benefited from. So I'm very cognizant of time. I do want to ask you one last question, Dr. Khan, and then I'll also invite you to leave any sort of grand thoughts, challenges to this pharmaceutical sector here. I do want you to touch on the issue of ethics in the pharmaceutical industry. As pharmaceutical manufacturers, as suppliers of life-saving treatments to patients in this country and other countries, we have a very serious responsibility. And manufacturing a medicine, a pill, or an injection is not the same as making a t-shirt. The t-shirt doesn't fit well, you can throw it away. With the medicine, you don't get a second chance. So in terms of focusing on the quality of what we produce, and also we spoke about AMR as a potential opportunity for Pakistan, but it also, the reason why it's such a big challenge here is because there has been consistent overuse of antibiotics. What role can the pharma industry play to encourage more ethical use of medicine, not overprescription, not overuse? Because in the end, ultimately, we're all human beings. We will all pay the price of what goes wrong.
So my organization and me personally, we spend a lot of time thinking about bioethics. In fact, when I launched Evolution as the founding CEO, under the guidance of my chairman, who is His Royal Highness the Crown Prince, who I have the privilege of being the CEO and he being my chairman, one of the first things we did was establish a bioethics committee. Before we established an R&D committee, before we established a grants and investment committee, we actually established a bioethics committee of the board and of the organization as an independent, and it's chaired by Arthur Kaplan, who's the chair of bioethics at NYU, formerly Johns Hopkins, and by Julian Sevolucci, who's the founding chairman of bioethics at Oxford University. So they are the two world leaders who are on Evolution's bioethics committee, including then a Middle Eastern, an Asian, to really look at this globally. Why did we do that? We did it because my concern as CEO as I was launching Evolution was not to just think as a scientist, and this is before I brought scientists on board and before I brought investors on board, was not to ask the question, can we do this? Because in the field of aging biology, there is a huge opportunity, but some major questions. And this applies to any field in life sciences. And the question was not, can this science be done, but should it be done? And that question should not be answered by scientists and doctors. I firmly believe that people who are in the profession of practicing medicine or studying medicine or researching medicine should not be the people understanding the ethics of that. That is the fox guarding the hen house. That's a conflict of interest. And so to prevent that, the first thing we did was establish that. That is relevant to your question because it applies to the whole value chain. And the value chain of bioethics in medicine and life sciences is not only what is being done, how is it being done, and for whom is it being done. And you touched on the third of that, which is what is right. And in the for whom includes not only the technologies that are available, but how do you make them accessible? Accessibility is often overlooked, even today by West. Let me give you a statistic. 50% of the drugs recently approved in the last few years by the United States FDA, 50%, the average list price of those drugs is $250,000 US per drug per year. $250,000 US per drug per year is the average cost of half the drugs approved by the US FDA. That is the future if we don't do something about it. In my mind, the bigger ethical issue is a different one, if I may take the privilege, which is something I've spoken about nationally, globally, and I feel very passionately about. We are going to see a transformation in life sciences and biotechnology in ways we have never imagined because of the technology that has now appeared at a molecular level and a computational level. I already mentioned that. But let's see what's going to happen. If you read a Nature paper authored by Professor Andrew Scott at Oxford University and London Business School, and if we were to extend health in the life of human beings by just 12 months, just 12-month extension, not living longer, but 12 months living healthier, on average by the population, the GDP impact for the United States would be $4 trillion. Just the US. Now add Europe, the UK, Japan, and see what the GDP impact is going to be. They have the technology to achieve that 12 months. Because right now, the average life expectancy in the United States and the developed world is about 76 to 78 years. Of that, 68 years is about the healthy life period. There's 10 years of disease on average. That 10 years is what is costing the United States federal government 2/3 of their Medicare budget. So this is why there's a tension. Now here's the issue. They're going to invest money. We're all investing money to extend just even 12 months, and the GDP impact in return on ROI is massive. But the cost of that is now running into the hundreds of billions of dollars. The concern that we as leaders have is the following. If the global north wealthy nations continue to extend their healthy population's health span, the GDP return will be here because there's very little unemployment. Unemployment in the United States is less than 5%. They can extend it, and that will give you productivity. But the difference in productivity and therefore GDP between those who have access to those technologies and can afford to pay for them versus those who don't is not just going to be a health disparity, it's going to be a massive economic GDP disparity. And so that wealth divide is going to continue to widen, which is going to be further challenging. And so what we have to be doing as leaders, as global leaders now, is not only to ask the question on the ethics of how to invest and how to study, but also how to narrow that divide so we can democratize technologies. That is the only way, by dividing and distributing and therefore democratizing, can the North continue to achieve its wealth and grow, but also in a stable, equitable world. Which is why if you go onto Evolution's website, our vision statement is very clear. Extend healthy lifespan for the benefit of all, regardless of age, wealth, religion, belief, residence, citizenship, or location in the world. If we do not think that, and why do I mention this? Because I'm not worried of the wealthy in Pakistan. They will always have access to your products. The multiple resistance, access to antibiotics technologies is going to be for that massive underfed, malnourished, stunted population of children that Pakistan is now home to, more so than any country that I'm aware of. It certainly is in the top 2 or 3. We are leaving that next generation behind, and therefore the life sciences industry, not only drugs, nutraceuticals, micronutrients, macronutrients, that whole value chain has got to now fill that void. And that is not only an economic imperative, it is a moral and an ethical imperative that's going to need the whole of society. So I hope that answers your question.
Yes, I was going to ask you for a final call to action, but you just did that very, very eloquently. Thank you so much for being such an inspiration to all of us, all the 250 members of the association.
Thank you very much.
And we've learned a lot from you today.
And thank you for leading next generation.
My goodness me, another incredibly insightful conversation. So thank you very much to both of our guests there on the stage. A really interesting fireside chat. I know it can be quite tricky to host a fireside chat, so that was masterfully managed. So thank you very much indeed. Now, without further ado, let's press on with our schedule because we have a huge amount to get through, a large number of really fascinating speakers who are going to be taking to the stage right here. So let's have our first international keynote address. We're going to look now at innovations in pharmaceutical manufacturing. We're also going to explore some cutting-edge applications. And our next guest is someone whose company has had a long-standing relationship with the Pakistan pharmaceutical sector. And it is a great pleasure to welcome to the stage Dennis Hall. He is Vice President for Advanced Manufacturing Technologies. He's a key leader at United States Pharmacopoeia. And just to remind you quickly that Mr. Hall will be taking questions from the audience at the end of his keynote. So please do, if you don't mind, you don't mind. I'm just throwing you under the bus there. So if you, as you listen, if you have any questions, we will have about 5 minutes at the end. But yes, please join me in welcoming Dennis Hall.
So thank you very much for inviting me to this just amazing day that we have. And I do have to say that this is the most number of microphones I have ever done a presentation in front of. Probably not for me, for the others this morning. Thank you. So in typical style for myself, I have prepared way more slides than I can get through in the next 20, 25 minutes. So I'm going to go relatively quickly through them. But I also will make them available for anyone that wants to go into a little bit more detail. The task that I was assigned today was to take a slightly different tack than what you've heard already this morning and look at advanced manufacturing technologies that could be applicable fairly quickly. And so through this presentation, I'm hopefully will leave you with a couple of goals for yourselves within your own pharmaceutical companies on where to advance. So. Okay. Oh, there it is. Sorry. Looking in the wrong place. I apologize. So. Doesn't seem to be advancing. Maybe. That's okay. Don't. It's fine. I can do my talk without the slides, and it'll probably go faster anyway. So, like I said, I will make these available to the entire audience afterwards. So, first off, I will. I do want to say that I am here representing the United States Pharmacopoeia, but all of what I'm going to be talking about today should be considered my thoughts and recommendations. They also don't represent any official interpretation from the United States Pharmacopoeia. So for those who are not familiar with USP, we are a not-for-profit, non-governmental organization that has the mission to establish standards and programs to support quality of medicines around the world. We're the only pharmacopoeia in the world that is not part of the resident government, and so we're independent from FDA, but we do work very closely with them. And we do work with regulators and manufacturers around the world. So from that perspective, the department that I am currently overseeing was put in place about 4 years ago in order to look at manufacturing technology specifically and to make sure that we're helping those companies that are looking at those advanced technologies implement them in a quality way, even if those technologies are not yet ubiquitous. And that's been a rather interesting challenge for myself within my team, and being in an organization that's 200 plus years old, you can imagine trying to be entrepreneurial in such a place can hold some interesting challenges. But today I want to focus on those manufacturing technologies that I perceive are readily available and applicable within the industry within Pakistan. So when looking at the, are they? Sorry, I didn't realize they were moving my slides for me. So I was just kind of talking. I think it's going to be easier, if you wouldn't mind, I'll just talk through my presentation and not worry about the slide transition. Thank you. In looking at the field of advanced manufacturing technologies, these cover a wide range of technologies that can be applied within the pharmaceutical industry. And they cover unique unit operations, unique dosage forms, unique ways of both doing chemistry as well as the engineering necessary for finished dosage form production. As mentioned earlier, the field of biologics itself is an advanced technology, but even within that, there are additional advanced technologies that are becoming much more readily apparent. Within USP, we've worked with a variety of those, including 3D printing, continuous manufacturing, et cetera. One of the most exciting ones for me as a physicist is microgravity manufacturing, which I'm not going to suggest here because this is very, very cutting edge stuff, about doing pharmaceutical manufacturing essentially in space. And so the fantastic things you can do with not having to worry about gravity, especially in crystal formation, has been really fascinating. But I'll put that to a side. That's probably a 15-year objective within the industry at this point. So I want to talk today about what makes all of those things I've just described what's common amongst them. Whether you're talking about 3D printing or continuous manufacturing of drug substances or drug products, automation, personalized medicine, distributed manufacturing, whatever those various advanced manufacturing technologies we're talking about, they tend to have three specific things in common. One is that they all enable a much deeper understanding of your manufacturing process, especially through the use of process analytical technologies. Two, they can all benefit from the AI and machine learning and advanced computing capabilities that are coming into the industry. We often hear quite a lot about the application of AI in drug discovery, but there's a considerable amount of benefit if applying similar processes to the amount of data you can look at in your manufacturing process and make real-time decisions around that. And the third is for all of them to be successful, you must have a much deeper understanding of the materials and the material properties in which those technologies are being used, probably more so than a traditional batch manufacturing system. So I'm going to take the third one. I'm also going to set that one aside because the rest of what I want to talk about has to do with the marriage of process analytical technologies with advanced computing, and in particular, the area of continuous manufacturing, which is, in my opinion, one that the Pakistan industry is primed and ready to move into, whether you're talking about onshoring your API production through flow chemistry or improving the consistency of quality that you can show in finished dosage form manufacturing, especially through continuous direct compression. So the reason I say that is has to do with the costs associated with materials and labor and facilities. The application of continuous manufacturing has been shown to be able to reduce greatly the cost of raw materials and APIs into a system as much as 25 to 85%, depending on which product you're looking at. The facility costs, because these have a much smaller and a much smaller footprint and can be customized and recustomized fairly quickly. That has been shown to have reductions of about 50% over a traditional system. And the downside, which probably isn't really a downside, the labor costs tend to, right now, be higher than normal by about 30%. The reason for that is things that were talked about earlier, of having to have mathematicians who know chemistry and biology, or pharmaceutical engineers who know how to do the modeling. That tends to be a higher skilled position, and therefore that raises some of the overall labor costs associated with it. But taken together, this has a great opportunity to reduce costs, and I'm not going to advocate that one would reduce price, but to improve your own profitability, being able to pull costs out of that system is really going to be important. But then for the purpose of the vision for Pakistan to become an exporter, the fantastic capability of understanding the process that you're using and to be able to show that to a regulator in a way that they've never seen before. I know of one particular system that USP has been working with that can do a 100% quality inspection. So just think about that for a second. They can do in real time a measurement on every single tablet that is being pressed and make a decision about whether it meets quality standards or not. Now, one doesn't necessarily have to go to that level of extreme in these continuous manufacturing systems, but if one can go to a filing as you're trying to do an export and say that I am doing even 10 times the amount of testing that you do normally within a batch manufacturing process. And here's my models that show, using AI and machine learning, that I'm establishing excellent quality. The regulatory approval process will be a lot smoother for you. Now, there's some caveats on there. Depends on which market you're going into, et cetera. If you're trying to go into the US markets, these types of approaches we've seen to be highly applicable and very successful, especially because FDA has the emerging technologies team that essentially helps any organization that wants to apply one of these advanced technologies along with the advanced processing power. So, from a perspective of where I see the investment that the industry should look at, I highly suggest that everyone look into various continuous manufacturing systems. I am working right now with the University of Maryland, and we're examining the application of continuous manufacturing from a financial risk perspective. And one of the most fascinating results of that analysis has shown that from a banking or investment perspective, it is better to apply continuous manufacturing in a greenfield plant in the United States, which, by the way, has the highest cost base probably out, with the exception of maybe parts of Europe. It's better to do that from a financial risk perspective than invest in new batch manufacturing plants in India or in China. And so if that can be the financial risk, the lowest financial risk aspect for new investment in the United States, I can only imagine what the competitive advantage an industry like Pakistan can have by applying these technologies sooner. As mentioned earlier, wanting to differentiate yourselves. I highly recommend differentiating on quality and the applicability of these new manufacturing systems. How do I know that this is possible in a market similar to Pakistan? Well, the United States Pharmacopoeia is actively working in South Africa as well as Uzbekistan on this very process. A bit in Kazakhstan too, but that's gotten on a little bit of a slower start. So in South Africa, we are helping both SAPRA, the regulator, as well as manufacturers develop an API industry. Not expand an API industry, actually develop from scratch. Very limited API capability within country. And we've seen some fantastic successes in where that has been going by applying continuous flow technology to their API industry. For Pakistan, the fact that you already have a established base is very important. You can then go faster and farther from an API standpoint. In Uzbekistan, we're helping there both in some respects on the API side, but on the finished dosage form side, looking at these newer capabilities such as continuous direct compression, where they'll be able to apply, it'll take a little bit longer in Uzbekistan than we're doing in South Africa, but the proof case is still there. As well as applying these new technologies throughout the United States as well as in Europe. And so I have a high confidence that an industry that has the intelligence base, has the basic understanding of the infrastructure necessary on both APIs and an advanced understanding on finished dosage forms can take the next step into looking at these various advanced manufacturing technologies and applying them as you're growing. Finally, I want to leave you with a couple of words of warning associated with applying API and machine learning within your processes. The use of artificial intelligence or advanced modeling for machine learning is something that we've all heard a lot about within the industry, and there's been a bit of hype associated with it. My word of warning is that those systems do not replace basic content knowledge and do not replace the expertise that are necessary to understand your manufacturing system. Because if you don't have that, the models that you're going to be producing are essentially not going to work. We've actually seen that a couple examples in the United States where they went certain companies went too far too fast in that space and didn't have that base understanding. That's in addition as to why I think the Pakistan industry is ripe to be able to apply that. That base of understanding and content knowledge is really quite prevalent within your industry. So, and with that, that's my advice, is to look specifically at advanced manufacturing technologies, and in particular, flow chemistry within API, and continuous direct compression, and similar technologies within the dosage form, and push the envelope of quality. Because if you can push the envelope of quality, it'll make your exports considerably more attractive, differentiate yourselves, as well as improving the quality of the products you're producing for your domestic market. So at this time, I think I will end and take questions.
A round of applause there for Mr. Hall. Thank you very much indeed. Now I'm looking around. Would anyone like to raise their hand to ask a question? I will ask people to keep to questions rather than statements because we only have 5 minutes. We have people roaming with microphones. Sir, yes, here we go. Thank you very much indeed.
Thank you. Thank you very much for your very learned presentation. I would like to ask, in case of continuous manufacturing, how you differentiate from the, in case of finished goods, the manufacturing stage and the packaging stage, and how you differentiate, maybe you are coming up again with the batch concept based on the timing, and especially for other test, for example, the stability studies sampling and their continuity. So that will be kind of a combination with continuous manufacturing of the basic bulk, and then moving along with the batch portions for the evaluation and also for the packaging area, especially its application for kind of non-compliance or recalls, and how you would be balancing this?
Thank you. That's a fantastic question and gives me an opportunity to mention a point that I probably should have. When thinking about continuous manufacturing, ICH guidelines specifically say that for something to be continuous, you only need 2 unit operations to be connected. It does not mean that you have to go from raw materials through a packaged product in a single continuous process. And so that's essentially how I would answer that question, is look within your process as to the areas that are most suited to doing that continuous process. I would recommend, for most folks, to not try and put packaging directly connected into your compression, for example. It doesn't make economic sense. It doesn't really make usually engineering sense. And within any of these, while one can set up a continuous process that can run 24/7, 365 days a year, most of the ones within the pharmaceutical industry don't do that. So the definition of a batch is still important, even in a continuous fashion. So it's usually off of time or volume of material that has been seen, either input or output, to define what that batch looks like. So hopefully that answered your question.
Thank you very much, sir, for your question. There's a gentleman just here. If we have a microphone, this gentleman just here. Thank you so much. We've got about 4 minutes to go, sir.
Hi, thank you so much for having me here for this question. Doctor, I just want to ask about what do you think the scope of API industry in Pakistan, especially when we look the world competition coming up from India and China. And second, I want to ask you, would you like to tell us, if we focus on in industry in Pakistan, will it open a new door for GMP and FDA? Thank you.
So that's a good two-part question. In looking at competing with China and India, my recommendation would be to look at the cost base of your materials, knowing that only approximately 15% of the APIs in your drug products that you're making for the Pakistan market are made here in Pakistan. The reason I say that is, and this is actually probably the only time I wish I had my slide, the material costs, when you compare the United States, China, and India, are relatively the same. So if you can reduce your own material costs by doing more here, as well as applying things such as flow chemistry that can reduce costs, increase yields, that can give you a competitive advantage even with the imports associated with coming from India or China. The other great advantage is you don't have to pay duties and taxes on the products that you're producing here. So that's another way to compete. And the second part of your question, I'm sorry, I actually forgot the second part. What was the second part? I apologize. So.
No, don't worry, the microphone's coming your way, sir.
FDA.
We'll still go with it.
Oh, yes.
You had the reminder.
So, you think so? I mean, it will open a new door for GMP and FDA if you are just formulator over here. I mean, that's it. Thank you.
So, I'm a big advocate of the FDA when it comes to advanced manufacturing technologies. I know most of the people on the emerging technologies team. I've worked with them quite a bit, and my recommendation for opening the door to FDA is to take and put a step into applying advanced manufacturing technologies, and then immediately open up a discussion with the emerging technologies team. This is one of the few places in FDA that you can get excellent advice well before you're filing. They will sit down with a pharmaceutical company, they'll ask you what your plans are, how you intend to do a variety of different things, and then give you advice on how to do it better. You don't usually get that if you're just going and submitting a dossier to the FDA. And so I think that's an excellent way to get into the GMP system with regard to FDA and improve the likelihood of getting an approval and therefore opening up a fairly significant market for your product.
I'm afraid that is all we have time for when it comes to questions, sir. But needless to say, we could prevail upon Mr. Hall in the lunch break, which is coming in a couple of hours' time. So hopefully you might be happy to talk to them. But in the interim, thank you very much indeed for what was a very informative discussion indeed. Certainly an interesting perspective on how we could export from here over to the United States. And our next topic is equally interesting. We are going to address that thorny subject of regulation. And our next speaker is an eminent professional from the pharma field. I'd like you to join me in welcoming Asim Rauf, who is CEO of the Drug Regulatory Authority of Pakistan, to the stage. Sir, thank you very much indeed.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. The honorable guests, the professionals, colleagues, respected Dr. Aslam Saab, Khalid Saeed Saab, and all the participants, Assalamu alaikum. It is a great event if we look into its theme. It is digital transformation. A digital transformation and commitment to proceed on it means transparency, visibility, and traceability among the system. So among the operations of the pharmaceutical manufacturers. As the world is changing, the digitization is an important part, and the commitment and theme of today's gathering indicates that we are on the right path and right track. Apart from various challenges that we have faced, both pharma industry and Drug Regulatory Authority of Pakistan, I'm glad to let you know that our export is increasing. Every year we go for unprecedented mark. Like this year's mark is unprecedented. We never achieved it before. There is a question that, is it sufficient? So the answer is no. It is, the achievement is not, I would say, sufficient. We need to move forward and get our share in terms of export as is expected from this country vis-a-vis other countries in the region. So the transformation and the steps that are being taken by the pharmaceutical manufacturers and TRAP that are aligning towards accessibility in the stringent regulatory market of the world. Recently, one of our diagnostic kit got access to UAE market. One of our Vacutainer, another product, got access to European market. So this is something about medical devices. We recently also got access to like Canadian market and some of the market that is we call like the regulated market, as I said earlier. So these are the successes that we share together today. And today is also a day of the commitment that the challenges that we face of exposing ourselves to the international auditors, we are ready for that. The pharmaceutical industry is moving forward, and RAP and the government of Pakistan expects that much more and many more numbers of pharmaceutical industry come forward and get themselves exposed to the international auditors. So DRAP is already doing its part. DRAP has exposed itself to international auditors. There is an audit expected for Central Drug Testing Lab, Karachi. There is an audit expected in the next month from WHO. And the system we have launched, we have been able to digitize most of our operations for the sake of transparency, for the sake of visibility. So today DRAP assures that the pharmaceutical industry, their objectives and commitment, DRAP is ready to collaborate with them and extend its services to all of them. Again, I would like to thank all of you, and I hope we get some concrete result today evening or way forward out of this event, and then we move further accordingly. Thank you very much.
Thank you very much indeed, sir. We appreciate that sort of lifting the lid moment there on the regulatory framework that we currently have in Pakistan, but obviously a throw forward to the future and what we could see in the future, which is very exciting indeed. Okay, so we're going to continue with our fantastic roster of events, our amazing guests, because we now have a keynote address on a really fascinating subject, because we're going to hear how AI, I mean, it literally is the headline in every single newspaper article at the moment. This time we're going to hear how AI is reshaping the pharmaceutical landscape from labs to leaders. And joining us for this intriguing and very timely topic is, of course, Dr. Semi Kumluk, who is Head of Artificial Intelligence and Digital for the PwC Academy in the Middle East. Now, Dr. Kumluk spent the last few days actually hosting workshops around Pakistan. Perhaps somebody here might have been to one of them. So he's actually been sort of educating people on the role of AI in pharma. So we're thrilled that he's managed to join us right here on our stage today as well. So welcome to the stage, Dr. Kumluk. Please do come and join us. And just a quick reminder that he will be taking questions at the end. So again, if you want to have a bit of a ponder on those, hopefully we'll have 5 minutes at the end when we can take questions. So thank you very much indeed. Round of applause, please, sir.
Thank you. Excuse me. Thank you very much, Chairman, PPMA, all the sponsors, all the organizing committee, and all of you delegates. It's my first time here in Islamabad. It's a very warm welcome, I must address. I know many people are watching Ertuğrul here, so I'm from Turkey, so hopefully you will have a good prejudice for me, and you will pay attention to me in the next 30 minutes. I asked AI to envision this session, how in a futuristic scenario, maybe the 10th edition, maybe 15th edition of this summit would look like, and it has this kind of a picture. It has an idea about Islamabad, right? I didn't visit the mosque yet, but it has some kind of a good idea here. We are all talking about the vision here. We had a nice dinner with Dr. Kasser 3 months ago about this session. I was delivering AI sessions in the past 3 days now. The interest, the enthusiasm around technology, around AI, around this session has been fascinating. So thank you for all that interest. Who heard that Apple might go into the health insurance business? Who is aware of this? Maybe some speculative, maybe correct news. Anyone? One. So why Apple should go into the health insurance business? What's your take? And they have the data, right? So they have a lot of health data. Maybe they know your health better than your doctor, better than your insurance company, obviously. So data is the new oil, data is the new power, but are we using it in action, in the business for our decisions? So that's the key differentiator here. Okay, we can ask to begin with, do we have the data? Yes, we have a lot of data in the industry, coming from the patients, coming from the physicians, your internal processes. We talked about the manufacturing system. They are generating massive amounts of data from the efficiencies as well. So let's put it into a fancy word. We have data-driven decision making. We are just increasing our efforts. There are a lot of businesses just pushing their leaders to make more better informed decisions by utilizing data. But is it enough? With our limited capabilities, with the massive amounts of data that we collect, one fact was in the previous slide as well, how can we carry it to the next level? How can we start from the top? With, of course, being cautious with the advices of Mr. Dennis. So how can we use AI to make better informed decisions, to use the power of algorithms? This will be my focus in the next 20 minutes. We have massive amounts of data coming from patients, coming from our own systems, coming from the other institutions. How can we use the power of machines, power of AI, power of algorithms as a decision support mechanism? That will be my main point. And you might be in, maybe in the skeptical part when it comes to AI. Many people say it is hype. There are many people approaching it quite slowly. Obviously, I'm in the optimistic pioneers quadrant, so also my challenge for this session is to push as many people as possible to the top right corner quadrant here. Okay, what's going on in the pharma industry? Just trying to not to move away from the range of the clicker. Okay, one of the biggest challenges, our team is also efficiency, right? Enhancing efficiency in the sector. One of the biggest challenges is the cost and is the length of the drug discovery process. Let me ask you, how many AI companies do you think are globally active in the just AI discovery area? Just shout some numbers.
So,
how many AI companies?
Do you know what I'm going to do? I do apologize for this. I'm going to let everybody ponder on that question just for 1 minute.
Okay.
I'm so sorry to interrupt
No
you. We have a guest here who sadly has got to leave, and as a consequence, we'd just like to award him with his memento very quickly.
Sure.
I'm
Okay.
so sorry
No
to interrupt
problem.
you, sir.
So-
But what's brilliant is that everyone can have a think about that question and answer it in a few minutes. But
Don't
I would
Google.
like to...
Don't Google it.
Thank you. I would just like to welcome Mian Khalid Misbah, our chairman, to the stage. Thank you very much indeed, because we did want to thank Dr. Asim Rauf, who is the CEO of the Drug Regulatory Authority of Pakistan.
Pleasure.
It's such an interesting conversation.
Sure. Yeah. Sure, no problem.
Government demands. So what we're going to do is we'll just very quickly award the memento,
Sure.
and then we will come back to your fascinating presentation. So thank you very much indeed. I think everyone was just at that moment pondering on how many AI companies globally are active in drug discovery. I know that living in the UAE, as I believe you do
Yes.
as well, it is a major focus over there in Dubai. We hear a lot about the different ways in which AI is going to help increase the speed of the production of these drugs. But we did hear a little bit earlier that maybe that is being overplayed. So that I'd be very interested to hear from you your perspective on that. And so yes, maybe this is the moment when people could shout out how many.
Okay, how many? 800? Anyone? 400? Just auction? 1,000? Going once? 2,000? Even more? Anyone else? So it is right around 800 because she's in the, not because she's Turkish, but she's in the research. So data really pays off. Around 800 over 700 AI companies, AI startups purely focusing on drug discovery. We have the corporations, big companies in the middle, the investors in those companies in the second cycle, and the drug discovery companies purely focusing on AI, using AI here. So hope it helps you move into that optimistic pioneer field. And when we look at those AI companies, most of them are coming from US and next Europe. And around 10% of those companies are in the Asia. And here is your next challenge. How can we make Pakistan appear in that leaderboard of the AI startups in the field? There's an interesting quote. There are 3 very dangerous addictions in the world. One is heroin, of course. One is sugar, which obviously is something in Pakistan, diabetes, and the third one is celery addiction. So how can we also boost that startup ecosystem here in the AI drug discovery field? We already had started to make conversations with the Dow University vice president during the break. So I can see the actions are just, the reflections are already here. They're all happening as we speak. Okay, I'm just out of the range. So this might be one of my recommendations, takeaways. Those who attended my workshops on Monday and yesterday got a little bit technical about machine learning, the training process, learning from data. So these big companies, top companies you see, are partnering or are acquiring some specialist solutions here. Why? Because you need to develop a narrow solution when it comes to AI. ChatGPT is more of a hype, I admit. I agree with that. But there is a huge opportunity when it comes to machine learning, okay? If you can make the machine, that system, learn from your data, then you can actually use them in specific pain points, specific challenges that you may be facing. That is the right path, that is the recommended path when it comes to utilizing AI in your operations. Oh, sorry, I moved too fast. Yeah, and this is giving the better idea along the drug life cycle, and for different use cases, we see the companies are specializing in specific areas. So this is the reflection. Mr. Dennis highlighted this one and his advice as well, like don't just jump into solving everything with AI or applying AI without knowing the underlying data, without interpreting data. This is just giving us this idea. These AI companies are specializing in some niche areas, as you can see. They know their field very, very well. On top, they are using AI. They are solving a particular problem from the industry by using algorithms and artificial intelligence. And it is happening. Almost 800 companies. And happening in China already. Just some examples, mainly driven by those small labs, small companies. Drugs have been developed. So if Dr. Mahmood would allow me, I would add the next generation after chemistry, biology, by combining AI with that process. Those approaches might be the emerging field in that particular area. If you read my bio, I initially studied chemical engineering, so I can relate to all this very well. I am not a pure IT guy. I am not coming from computer background, just trying to walk the talk here, just what we focus on. And to make your lives even easier, big tech companies are moving into the field as well. I just told the story of Apple, but it's not the only player or only the prospect when it comes to using tech in health. Microsoft's cloud platform is as a specific solution or solution landscape dedicated to healthcare, because they have big expertise managing big data. They have expertise in the cognitive solutions, and they also started applying those in healthcare as well. So that might be another path in addition to those partnerships with startups, etc. Last time when I was in Karachi, we did a session on in the National Space and Technology Center as well, next to the airport. So also we can push these in the industry as well. And these are some examples of companies, pharma companies using Microsoft as a solution, Johnson & Johnson using it for internal efficiencies, enabling employees access to data in a much shorter times, in a like a internal ChatGPT that they have. They are using Microsoft Cloud to access and analyze this data. Another company, Cry, are utilizing it, and they claim they achieved 20% improvement in productivity against similar chat capabilities. So as I was saying, it is already happening. It is not a far distance. Dr. Kausar highlighted, tomorrow is already today. It is happening. And with the availability, I call it democratization of these tools of technology. You don't have to start from scratch. You don't have to start from raw data, then move into improving your data analytics capabilities. You can benchmark with these top examples directly. Another one, these are the examples of those in my earlier slide, but IBM Watson is also one of the early cognitive platforms. They have quite, they started in 2000, before 2010, and also they have specialized solutions for healthcare, pharma as well. Which company is this? Which company is this? Google. Yeah, the colors just are obvious, right? They also have a healthcare solution, just for your reference, and also for the attendance of my workshop, the machine learning training and the predicting processes. They are helping with deferral to clinical process as well. Another fascinating result from their solutions. It just occurred to me when I was preparing for this one. Almost all the lab test results are digital data, right? You do blood test or any other kind of test, it is in a computer-generated report, yet they're all read by, analyzed by human beings. I didn't see, before this, I didn't see an actual example of that data analyzed, read by computers. Because it's available, they're all digital data, not handwriting or anything, But when, especially severe situations, it only puts an asterisk, makes it bold, but it doesn't create some kind of alerts, etc. So how can we utilize? We have the data ready. We can embed very simple AI solutions just to reap that data available. So we don't have to directly go start from the most advanced solutions. Predictive maintenance in manufacturing is very mature at the moment, so we can start with that one. Using it for logistics optimization is again mature at the moment. We can start with those. Then we can walk our way into more drug discovery, more sensitive data, patient data, molecular data, etc. That is possible. And if you have enough data, and by using these powerful algorithms, you can detect many, many diseases, or at least the early indicators from various data types. And this is another example by Google already. They are able to detect many different diseases just by the cough, the voice, the cough is analyzed by their AI model. And these are the companies already partnering with Google already. Of course, subject to regulations, leaving data outside the country, uploading cloud. I'm aware of those restrictions, but we can start exploring immediately. That's my message here. It is happening right now. Who was aware that there was a platform called Pharma.ai? Did anyone check this website, know this website? Only Mr. Dennis, also Ms. Punar as well? Okay. So your next assignment is to go on that website. So this is of course, this is a proprietary platform. If you know, in Clinico, one of the early examples of using AI in drug discovery. So they are just grouping their solutions, AI-driven solutions, on the website Pharma.ai. I will give deep examples of some of their solutions as well. They are using the Copilot, the GPT names as well. They also go for the hype around it, but definitely they are already achieving some results. And some other examples of big global pharma companies going through partnerships and some acquisitions examples. So just from a benchmarking perspective, big pharma companies globally, they are not trying to build all the solutions in-house. Again, it makes us think, how can we create a cluster of health tech, pharma tech, in coordination? We bring them to the PPMA, like PPMA tech kind of an hub, and just nurture the development of AI-driven solutions in the industry with those startups. Because we all know the flexibility of the startups. They start with the tech rather than just being driven by the industry, operating industry for many, many years now. So that's also another message, how we can utilize this in pharma industry in the Pakistan. And these are some Asian examples. The companies on the blue right and left are Asian AI companies. In Silico is here as well. They are working with those, again, big pharma companies globally. So there was a question about competing with India, China, here in the region. Again, that's another challenge that we can take upon. So 3 examples of those companies in Silico. These are their specific platforms or solutions from that Pharma.ai, Pandomics, Chemistry 42 in Clinico. From start to first in human, how many months? 27, just over 2 years. Remember my first slide? It was 10 years, right? So as an actual example, they say from start to first human is just over 2 years. Sorry, I moved to the wrong direction. Cyclica, they have a very nice platform. They are using neural networks, if you are familiar with the term, for matching the molecules with the, to predict the protein interactions. And also they are using another machine learning technique we call unsupervised learning to find the similar molecules, to find the similarities between the molecules, between the current drugs, current tests available as well. Another stand-time AI platform is first-in-class compounds they generate within 7 months by using here. Of course, we are not removing human from all these processes. That's obvious. Like we put AI solutions on top of our expertise in the industry. That's given, that's there. But we are running all these calculations, all the combinations, which is not easy for us to consider. And we are getting the suggestions, possible suggestions from those algorithmic calculations rather than going through the manual way. That is the power of using AI here. Okay, what is the message to the leaders of your, as leaders of your organizations? You don't have to switch careers. You don't have to become a tech company. You don't have to invest a lot in technology to reap the benefits of AI. You just add AI. You can just push your teams to add AI into their operations, into the way they are doing their jobs. And we have seen this trend in the past 10 years. First, it started with smartphones. After smartphones, everything became smart, right? We have smart homes, smart offices. Then we had the digitalization. We have digital in everywhere. So the next wave, without moving our field, without trying to become an AI expert, is how do we add AI to what we are already doing? And the bottom line, AI is expected to generate $16 trillion economic value by 2030 through quality, through productivity, through time saving. So when we start early, we get more of this pie of $16 trillion. Just to give you an idea, again, to the competition question, it is equal to China and India combined. Just one technology, with a broad technology only with AI. So I'm hoping that I was able to push more people to the optimistic pioneers corner. So as I tried to focus all on the examples. I didn't use any slide I have been using in the past 2 days, but it is actually happening right now, so we need to start right. Thank you very much for your attention, for your participation.
Thank you very much indeed, sir. Now, we do have 5 minutes left where we could take some questions. If there is anyone in the... Oh, here we go. We have a gentleman super keen. Here we go.
Okay, so I am Waleed. My name is Waleed. I have a question. That question is that you've been telling us about how India and China has been taking up with AI. Now in Pakistan, the local market and the local companies are stronger in manufacturing. And so how do we add that AI, all these things you've told us, to our manufacturing units and organizations? Can you please specify?
Yeah, thank you. Thank you very much. So we need to just add that AI ingredient. So you are already to the, that's one good pathway, good strategy to find your strongest area and to be the best in the world. You just make it shine even better. So I would, because manufacturing is, if you look at manufacturing industry, there are more generic solutions here, so you can easily find. So I would suggest you find the solutions, already available solutions, solution providers who are helping with improving productivity, reducing the costs, reducing the breaks, deficiency, wastes by using technology, by using AI. There are already many solutions available. I worked on one project myself, and just further develop your edge in manufacturing. That's a very good strategy, actually. Yeah. Thank you very much.
Do we have any more questions? Oh, there's a, here we go, one over on the right, sir. Thank you very much.
Hi, my name is Hashim. I represent a very small pharmaceutical company, goes by the name of Canada Pharmaceuticals. I just want to ask you a question. We have Mr. Asim Rauf here as well, representing DRAP, and we have Dr. Mahmood Khan representing Evolution, a great project. How can we create a unified HMIS system which will help collect the data of the subcontinent or Pakistan itself, and then we can use that data to cater to all these problems that we are facing with the diseases, new diseases. We don't have those very medicines ready for that as well. And how can we use that data, the specific data of this region through HIMS and integrate it with the products and the tools that you are offering here or you have told us about? And how can that help us in Pakistan? Because Pakistan is not on the map, nor India, working on this very project right now.
Yeah, thank you. Thank you very much. We had a discussion about this on Monday. I know it's one of the challenges. Government initiative or sponsorship and also setting the right regulation is very important here. In Turkey, you can access all your health data, whether you run a test, whether you buy any drugs from a pharmacy, all your doctor visits, their results from a centralized health platform by the government, by the health ministry. So they already consolidated, linked to your citizenship ID. So all these activities you do has to be linked to your citizenship ID, and government is giving access to the people, to the public, not yet to the innovators, companies, to the public. We can access that in a very best way. So government initiative is very important here. After that, the benchmark could be the open banking. Open banking, we don't have much open health strategies yet. Open banking is about central banks collecting all the data and providing access to the banks and fintech companies in any given country. So we need a similar setup for secure data sharing with the players, for the better of the public, to innovate in the field. That is possible by benchmarking the banking industry here. Even another example, now when you log into that Turkish Health Authorities app, it is asking consent for your steps data from your phone as well. So also the government is just, have noticed Apple's activities, Google's activities here. So they want to cross-check that health data with your exercise, daily lives, lifestyles, steps, etc. So these are some good benchmarks to take, I believe. Thank you.
Thank you so much, sir. I mean, such a key topic, and I think one we're all sort of attempting to grapple with, but I don't think you could have made it clearer that the future is here, it's now, so we all need to get on board, essentially. So thank you so much. A key note speech there, and we really appreciate your presentation. Can I have a round of applause, please, for Mr. Semi Komluk? Thank you so much for your time. Right, it's time to get busy on this stage because I'm going to be welcoming a panel of exemplary guests who are going to be joining us on the stage. If you know you're one of those guests, please do stand up and make your way to the stage now because we are going to be having a discussion, a CEO panel discussion on navigating the future of pharma exports. We're going to be looking at leadership, we're going to be looking at innovation, and we're going to be looking at strategy. So please welcome to the stage Dr. Marwash Khan, who is the Managing Director of Pharma. Please do come up, sir, and take a seat here. And then we have Amir Altaf Qureshi, who is the Managing Director of Hilton Pharma, worth mentioning, one of our key sponsors. And I'm so sorry, Marsh, of course. Then we have Dr. Faisal Kokar, who is going to, yes, please, sir, thank you, who's going to sit, oh no, sorry, sir, you're there. And yes, sorry, I'm having to position everyone. Thank you very much indeed, sir. Dr. Faisal Kokar there. And we have Takir Al-Haq, who is the Managing Director of Sante, who's going to join us, I hope. And then we also have Hamid Zaka, who is the Managing Director of Shahazu Zaka. So are you... Taki, thank you. A pleasure to meet you, sir. Please do have a seat. As you can tell, we're in a very dynamic situation here. Thank you so much, sir, for joining us. I really appreciate it. I'm going to take a seat down here. Hang on a second. So many guests, so much fun. So if you all note that you have these microphones, gentlemen at the end, I think you may need to share, but do feel free to sort of, in fact, I don't need one, do I? So maybe we can give my one down here. If you excuse me for a moment, because I can talk very loudly with my one. Here we go, sir, if you have that one. There we go. So it's going to be one of those really interesting conversations because it's not often that I'm a journalist by trade. It's not often that you get CEOs willing to answer the questions of a journalist. But they've got to now because they're on stage in front of all of you. And I'm actually going to start with quite an open-ended topic, to be honest, because I'd love you all to consider the greatest challenges that are actually facing the pharma export industry in Pakistan at the moment. So just, I'd like to get your insights on that. And I'm going to go to my notes now because I know that Takir Al-Haq, who's the Managing Director of Sante, is happy to take this question. So I'm going to go to you, sir, while everyone else on my panel considers their answer as well. So go ahead, sir. Yeah. Thank you.
Thank you so much. If you look at the export of Pakistan pharmaceutical, at this point in time, if we see overall export of pharmaceutical is around 700 million US dollar. If you look at the entire therapeutic area, therapeutic goods we are exporting. But I think the challenge we face here is that when we see our neighboring country like India is exporting more than 28 billion US dollar and Bangladesh has also expanding its exports like better than us. So I think the basic challenge is that the structure, we need to, bring reform in the structure of export, whether it is the industry or from the governmental level. For example, it is very difficult to establish our brands outside Pakistan because it involves lots of resources, right from the start of selecting the market and getting the products registered outside Pakistan. And then after, all these stringent testing and everything, when we get our product registered. So the basic competition we face outside Pakistan is that we are facing tough competition from India and Bangladesh and other countries. The exchange proceeds, which is allowed by the State Bank of Pakistan, is just 15%. So it is really hard to, first of all, go in the market, pay the commissions to the distributor, or if we have our direct field force there, and if we want to establish our brands there, marketing initiatives, and we have to pay to the consultants as well, and we have to, establish our brand against the competition we have. So this is the major issue which we face, and we have been, talking to the government and the Ministry of Commerce and State Bank. So I think this is the biggest challenge which we face. And the moment, like for example, in IT, IT is one of the major export other than textile. So in IT, government has allowed 35% exchange proceeds, while we have only 15%. So the government should look into the fact that this is the tremendous potential and a new area which can bring revenues. And if industry gets this assistance from the government, then skies are the limit. Secondly, I think from the draft level, we have to make sure that they should work with the industry to make the things easy for us. Ease of doing business is very important. For example, for GMP certificates, we have to apply for each country differently. We have to pay fees and the inspection is there. While in other countries, journal GMP certificate is issued, which is valid for every country. Then I think in India, the major reason of expanding export is that they have a facilitation unit there by the name of Pharma Excel. We don't have any specific facilitation center here, which should be owned by the government, and a task force comprising members from industry, TDAP, DRAP, and the Ministry of Commerce. They should be the members of this facilitation unit, which should strive hard to expand export outside Pakistan. And finally, I think the biggest issue is that for us, the government should give incentives. There is no incentivization for which is given to the companies which are interested to export. And there is a huge duty structure, sales tax, because we have to invest into every other day we have to upgrade our manufacturing facilities, and that requires so much investment. So I think government should give incentives in terms of duties and sales tax, so that all the companies already working for export and who are interested to go for export, they should be able to come forward and try to increase the export. So these are the few basic challenges which we are facing.
A fantastic sort of overview there of the challenges. Shah Nawaz from High Noon Laboratories, I'm going to come to you now. Would you agree with that? There's issues with ease of doing business. There's a need for collaboration. Sorry, sir. Dr. Faisal. Actually, Dr. Faisal, I'm going to come to you on another note on that. Can I ask instead? I'm going to ask Takur ul Haq. Oh, no, you just gave me that comment on that. I'm so sorry. My guest list changed quite dramatically near the end. I'm going to come to instead Hamid Zakar. Can I ask you whether you also agree that we need to improve the ease of doing business? Please do feel free to move the microphone towards you, sir. Thank you very much. I know that you have a startup. And I'd be interested to know your insights on this as well.
Thank you so much for that question. In terms of collaboration, when earlier we were discussing about how Pakistan, on a global climate, how can Pakistan compete with India and China? So when we look at it from a collaborative point of view, again, we are in the formulation industry, and most of us are focusing on generics. So at this point in time, our entire API capacity is just 15%. So 15% of the APIs that are being manufactured in Pakistan. So our best bet right now, if we want to gain a strong foothold in the market, in the global market, we would have to work with the API manufacturers in Pakistan, collaborate with them, integrate vertically, and that is how we can get to the we can get the economics, the cost point of view in our hands, so we can offer better rates in the market and grab a larger market share. Another thing which I would like to add here, since we were discussing how how our companies can further our market share, practically what I have seen is most of the companies in Pakistan, they have to increase the patience that they have when they are entering global markets. Because this is a very long-term perspective when you are entering an international market. When you are entering a new market, you have to focus on your registrations, you have to focus on getting your products registered, you have to pass through all the regulatory impediments. So it is important for us to be patient, to focus on our capacity, especially in terms of our production and our quality, so that we can enter these more regulated markets. And further, we need to specialize. So rather than being a jack of all trades, we should try to focus on a particular segment, on a particular disease or a particular molecule, so that we can achieve those level of scales. When we're going to be focusing, we will be integrating with the API manufacturers, with the best production technologies, and hopefully be delivering products of the highest standards to stringent markets and hopefully increase our market share over there.
Thank you for those insights. I knew that I was missing a guest, and it is Shah Nawaz, who I believe is now going to join us on the stage, because I'm super keen to get his comments now on this question as well, on the challenges. So thank you so much for joining us. We really appreciate it. I'm afraid it's a baptism of fire. I'm going to ask you a question immediately, because we would like to know, just to get your perspective. Facing the pharma export industry in Pakistan at present. We have about a minute with you, sir.
Okay. What we believe that if you need to understand about the challenges what we are facing in export, we all knows about the 4 P's of marketing. And I think you need to understand the 4 P's challenges related with Pakistan export. The first P is the plant. So we need more regulated plant. Unfortunately, unlike Bangladesh and India, we don't have much of the WHO approved plant here. And the time is the key. If you ask me, for any business, time is the key. If today we decided to enter any of the market, it will take at least 2 to 3 years to be there in the market. With a certain product mix, maybe we select the product mix for today's need. But when we entered in the market after 3 to 4 years, then maybe the opportunity may be diminished. So that's the greatest challenge is the plant. Unfortunately, we are not the part of the PICS as a regulatory body of Pakistan is not the part of the PICS. So we have to apply every regulatory country for the plant inspection. So they do come, visit us, and then after that, the product comes. The second P is the product. So we know we need more compliant products, the quality by designs, because our products needs to be effective in vivo, in vitro, and in vivo both. Unfortunately, the landscape of the regulatory landscape has been changing since last few years. More understanding about, the more insight about the biowaivers and the bioequivalency. Unfortunately, in Pakistan, we don't have much of the bioequivalency studies, CROs. Last 2 days back, I visited DUHS in Karachi as a CRO, and they have the fantastic facility, but unfortunately, we don't know much about it. So that, even that CRO needs to be WHO accredited. So that actually help us to be there in the market with the better plants, then with the better product. The third is the pricing. Rightly said by Dr. Khan that the pricing is not the sustainable competitive advantage anymore. The fourth P is the promotion. And the promotion where the Sumit was talking about the AI in different areas, particularly in the product development. And I think there is a huge opportunity of AI in the promotion side. So digital wrap is next to the door. So we need to work on these digital aspects of the promotion, because we understand that we cannot create any differentiation in terms of the pricing. We can only differentiate in terms of our plants, in terms of our better formulations, and the third one is the promotion. So that is my take.
Really interesting. I think through those questions, we've really fleshed out quite a lot of the challenges that are faced here in this market. Dr. Khan, I'm afraid I'm going to put you under the spotlight now with this idea of regulation, which of course was just brought up there. Does the responsibility fall to the private sector to come together, or do we need public sector assistance?
Thank you very much. I'll take it from where Mr. Shahnawaz left off. He's talked about the private sector, that what we are supposed to do, but this has to be coupled with the government sector, right? Without the government support, we can't go anywhere. If you look at what India did, they incentivized the industry. They brought in MAI, which was Market Access Initiatives. They started off with that in 2001. And then from there, they just focused on the product and the country. Then they brought in PLI in 2018. And after that, which is the Product Linkage Initiative. And they've instilled about $2 billion into the system, and they are focusing on SMEs as well as micro plants as well, and they brought them in. So without all of this, I mean, if Pakistani government also gets behind us and incentivizes us, then probably we have a better chance of going forward.
Would you suggest that there is another country, Dr. Khan, that has an exemplary framework that Pakistan could model?
Yes, I think that Pakistan can have a hybrid system. So follow what Bangladesh is doing or what India is doing, a bit of what Malaysia is doing, bring in the halal certifications as well. So we can have a mixed model going on for us, and maybe that would work better.
Dr. Kokar, now of course you sit on the board of directors for Remington Pharmaceutical Industries. I'd like to ask you about trading partners, because we all know that they are of course key. We've heard about that already today, not least, you know, the United States. But how can we develop these trade lines?
All right, thank you very much. I'd like to answer this question in two parts. First, I would like to I'll sort of talk about in the second part about the sort of the sketch which Dr. Khan just presented us with a beautiful night and the stars are shining and we had a moon and we need to sort of aim for the stars. Okay, so I'll come to that in the second part. But the first part I would like to take through is where our industry is at this stage now, because that's also very important. We must not forget where are we standing now, and from where we can go to sort of the sketch which Dr. Khan has presented in the morning. So where we stand right now is that we don't have anything to differentiate ourselves. We have to be honest, right? We are very, very generic. Okay, and there are about 29,000 plus companies in India doing exactly the same, and they are far ahead of us. So how are we going to be sort of competing? And okay, so my suggestion is that we need to first up have studies done through a consultant, primarily supported from a commerce ministry, okay, who can identify the gaps. Where are the gaps? Because we cannot differentiate right now. Okay, and we are probably, Remington is probably the most cutting-edge company within the pharmaceutical industry. And coming from them, I'm telling you that how we are operating, we are trying to sort of develop products for European market, and the challenge is immense because the level of sophistication required for a European consumer is beyond the capacity we have today. So every day we struggle to put ourselves through the paces to develop at that level, okay? So what we need to do is get a consultant through a commerce ministry can be funding that, and we need to look at Africa and East Asia and look at where are the gaps. Once we have identified the gaps, then we can develop. PPMA should play an extensive and important role in developing the linkages with the other industry associations, because we need a collective power. We all are trying to, what Ms. Tokir has said very rightly, there are so many challenges and we're trying to solve them individually. We need to come to a collaborative way, and PPMA is a great platform for that, that we need to establish links with other such association in Africa and Asia, East Asia, for us to get some bargaining power collectively. And third part is that we need to use our leverage, sort of diplomatic leverage with our different countries to establish that. And the last, not the least, if we want to go towards the direction which Mr. Khan has highlighted for us in the morning, we must develop managerial capacity. We seriously lack the managerial capacity. We have huge number of, because I'm associated with lots of universities, young people with a lot of talent. We need to engage them, and we need to have HR directors who are globally aware how to run teams. So I think the last part is critically important for us to take the leap in the direction which we have talked in the morning.
So for this leap, we're going to need innovation. And for that, I turn to Amir Altaf Qureshi, as you know, Managing Director of Hilton Pharma, our presenting partner. So I'm going to finish this fascinating conversation with you, and I'm afraid I have a sticky question for you, which is, you know, we all agree that we need innovation, but how can we drive innovation in this field?
Thanks. I'll continue what...
If you put it very close to you, it'll be happy.
I'll continue from what Dr. Mahmood ended up saying. The kind of resources that the developed world is putting in is humongous. Unless academia, institutions, and big pharma, they don't collaborate, I think innovation won't take place in the developing countries. If I look at even US, the most sort of a degree Dr. Mahmood is nowadays SEM, cellular and molecular biology. You go to colleges, high-end colleges, and most of the students academically who are quite good, they are pursuing that degree. And biology probably, I think, as Dr. Mahmood rightly said, would be the key driver in innovation. And in Pakistan, especially Southeast Asia, the collaboration among the private sector, academia, institution is lacking. So that has to be driven, I think, mostly by the pharma and with the support of the government for the institutions. If I look at, I met senior executives at IMD from a big food company, globally the largest one, and they've started working on the preventive and precautionary medicine and the healthcare products. So they're collaborating with insurance companies who end up paying a lot of premium for the people over 60. They're working with the pharma companies, and they're digitalizing the database that the patients would have so that they can go into the preventive care and predictive illness. So that innovation, especially for the countries who don't have been able to afford a high-end products, like as Dr. Mahmood was saying, that $250,000 is the average cost of a product for a yearly, which is unaffordable, unimaginable in this country. So just to summarize, if we have to really go on innovation, a lot of collaboration among the institutions, private and public, would be required, and a lot of digitization. As the curriculum that we are teaching at our state schools or private schools, we need to be focused more on biology. We cannot have mathematics and biology separately. They have to come together to do those analysis and those predictive models to help us on innovation. Thank you.
My goodness me, so interesting. So many themes sort of sewn together there in a really sort of rich tapestry of conversation. I'd really like to thank all of our speakers, particularly for their patience with me getting in a bit of a pickle at the beginning of our conversation. Every single individual gave us some really truly insightful statements there, and I'm sure you'd all like to join me to thank them for their time and thank them for their insights. So thank you very much indeed. It's been an absolute pleasure. Thank you, sir. Thank you. What a wonderful conversation, and it's not often I get to speak to so many CEOs at one time. You're very lucky I didn't have that much time with you, because otherwise I would have gone into full grill mode. Really, really interesting stuff. Now, we haven't got long before lunch, but I can tell you now, we have got some really exceptional speakers in that time. And I think that we are going to be welcoming Jan Kamal Khan, who's Federal Minister for Commerce, to the stage in the next few minutes. But first of all, I'd like to turn our attention to, well, we're basically going to be looking at how you can leverage market research to improve your growth. And to that end, we have an eminent expert who's going to be joining us on stage for an international keynote presentation. I'm hoping that Pinar is ready and prepped to come to the stage. I think she is. Pinar Kivelsim, who is Global Client Officer for Emerging Markets for Ipsos Healthcare in both Turkey and the United Arab Emirates. She has got a phalanx of research to share with you, and I'm delighted to say that she joins me now on the stage. Welcome, Pinar. Thank you very much indeed.
Hello, everyone. So I think I'm audible, right? It's a great honor being here today. Thank you so much for having me. And what I have been seeing, thank you so much. So this is Pinar. I'm from Ipsos, one of the market research companies that has been operating globally in 100 countries. And definitely Pakistan is one of these countries, and it's super important to our business in total. And I'm seeing that there is a huge potential of this country. This is my first time in Pakistan and in Islamabad, and I have to admit that I am so impressed. So it's been an honor today to kind of trying to give a little bit of inspiration if possible, because I see so many commonalities from all the speeches in the morning and also the CEO discussion, the panel discussion. I'm so feeling lucky that I'm just right after that, so that it's gonna be a little bit of inspiration to give you when you are back in your offices, to kind of give a little bit of thought in terms of how you can be able to utilize insights, because I would like to also challenge a little bit Dr. Semi in terms of data-driven decision-making, because yes, data by itself is the superpower. However, giving a meaning to the data is also something super important, that it's gonna be insights and data-driven decision-making processes that we have been seeing the whole world is now going through. So what I have done, I have chosen a specific team in terms of seeing that there is a very big ambition of the industry in Pakistan to do even further and bigger exports, which means that it is very important to have all the tips and tricks for better strategies to access, to enter into new territories, new markets. And research, market research, can help the industries, and definitely healthcare is one of those industries, to kind of make better and well-informed decisions across various angles. And those angles can be sometimes how to have better communication with healthcare professionals. It might be sometimes how to better understand the unmet needs of the patients and how to respond better to them. But sometimes it might also be very helpful for the industry to make better strategies in terms of how to enter into new markets. So that's why I choose the theme today for market access. Before going into that, I would like to give a little bit of, let's say, glimpse on the trends that we have seen in the healthcare and pharma industry globally. Hello, I don't think that the clicker is working. Yes, okay, cool. So we have seen some of these ecosystems in the healthcare that are really evolving rapidly, and that I would Excuse me, so this is not moving. Okay. I think it's because of the animations would not be working so properly, so just please allow me to first open them and then I will go. Based on the healthcare ecosystems that are really evolving, we see some trends that are happening in the world which are quite linked to what we have started to discuss today in this conference and summit. So there are, first of all, very large variations in the public health expenditures. So as a country, if you would like to export into different territories and markets, we know that every different market has their own expenditure plans, publicly or privately. So that's why we have seen these large variations, that it needs to be quite important to know how to act better to each of those different variations. And there is a shift that we have seen towards the value-based healthcare. If you remember, for the last 10 to 20 years, it's mainly the volume-based healthcare that we have been spoken. However, with all the advancements in the technologies, in the healthcare space, we are now seeing a huge shift to the value-based healthcare. That's why in the previous discussion of the CEO panel, I have heard from the CEOs that there is a bit of differentiation needed, right? And for that differentiation, it's mainly coming to this, how to showcase the value of your products, the value of your drugs to your stakeholders, to your new markets. And we have seen this evaluation of the HTAs, the health technology assessments, is now becoming almost like a must-to-have thing. So that's why this is something impacting the whole ecosystem that we are seeing. There are increased budget and pricing pressures, which I'm sure we have all been witnessing in all the countries. It's not only in Pakistan, it's the same for the whole world. That's why it's very important to give better responses to those pressures. There are innovative, high-cost health technologies, right? Technology is never cheap. It's always having a high cost. So that's why how to become innovative by keeping all these high costs into consideration is something that is really impacting and influencing the whole ecosystem. There is an increased use for the real-world evidence in the whole industry. So that's why if you would like to showcase your product and that it is a good value for the money that you are looking for, you have to also showcase what are the real cases that is really giving your product this value. And the patient engagement is something so important that we are seeing. The patient-centric research is now improving in the whole world and in the whole ecosystem. The future development and all these access trends in the emerging markets are expected to be influenced by some factors. And coming to these factors, we can say that there are three main that I would like to focus on. The need for innovative pricing strategies, because we know that there are so many countries, nearby countries, our neighbors, having very different and lower price strategies. So that's why we have to have this need for being innovative. The collaboration with the stakeholders. I think this is what Dr. Mahmood Khan referred to in his speech in the morning, that the collaboration not only within the industry itself, but also between the public-private partnerships, that's been really so important. And definitely by coming... Sure. Okay. Is it better? Thank you. And with all these non-communicable diseases that are really kind of in the rise, that we know that the preventive medicine is now the main theme across the whole industry. In all the global summits, in all the global conferences, now we have started to hear more and more about the vaccines, more and more about the preventive
medicines. So that's why it's very important for us to have a much better collaboration between the whole ecosystem stakeholders. This is exactly where we have seen this collaboration happen, I think maybe the best in class during the COVID time, because it's the only maybe time that it really influenced the whole world. So that's why this collaboration needs to happen on the country and on the local levels as well between the full ecosystem stakeholders. And the policy shaping HTAs is also another factor that is really impacting all the developing markets, because we know that to drive these innovative therapies in the emerging markets, the capacity to speed up the regulatory approval processes by the approvers is so important. That's why, like, I think in Dr. Sami's discussion and his speech, he refers how to implement and use AI and the digital health solutions to have effective data management, which those data managements can help and support the industry to have better discussions with the regulatory authorities like DRAP, and then making some faster registries and faster approvals, which would definitely be very important in today's speeding up world that we have to be quite speed as well. So that's why we can leverage AI in these terms. So the deeper understanding of the market access overall is desired to address and accelerate the solutions to these evolving trends. And how to moving into this space, I just would like to make a small glance at market access, because there is a bit of definition that we are using for market access, which is like, we know that market access is something where we need to have the patient to access to the treatments at an acceptable, affordable price, because it has to be acceptable. We have been discussing that it's all about accessing to better healthcare and to better medicines from the patient's perspective. But at the same time, it needs to be a maintained access, which means that there is the second part of this story, which is the industry itself. For the industry, it must be achieved in such a way. I think this is why these kind of conferences and summits are so important, by putting both the industry and the decision makers and the payers in the same room, because for the industry, it must be achieved in a way that ensures the appropriate return on investment is there for the manufacturers to maintain this access to the patients. This is how overall level we define market access. And then there are so many parts to kind of where research or where market access strategies can support the industry to make better informed decisions. So focusing on market access typically comes after the regulatory approval and just before the launch. So thinking about the whole product life cycle, right? Starting from the development of the drugs to going into the regulatory phase in terms of getting the registries and the approvals. Then during the launch time, that there is this physical launches, marketing activities, the experiences, the supply chains, and then after the last post-launch period, there will be all these maintaining the success of the products and then making it a surveillance throughout this management. But there is this specific part which is just before the launch, where we generally see the market access that typically comes in. Because there is the assessment of the value and setting the price and reimbursement if applicable. So we know that Pakistan is mainly an out-of-pocket market. However, for the exportation, when you have been thinking the nearest countries in Southeast Asia, there have been so many different reimbursement schemes in place, and for you to kind of make better decisions and better entries into those markets, knowing how the best possible reimbursement schemes might look like for your product, by learning from what has been done so far, what's you have seen in those markets happen, like having some analogs in that specific areas, in that specific territories would be very helpful. There is also the goal for getting the eligible patient access at the price that is affordable. So that's why you need to kind of better understand who is my target patient profile, my target patient, and then for the public and private payers, we know that cost of access has to be affordable and also the financially sustainable, as we have just mentioned a minute ago. And the industry needs to have its return on investment from all this. So in this evolving country like Pakistan and many other evolving markets, there are some clear challenges that we have seen affecting the pharma companies. So that's why it drives some demand for solutions, where we have just been discussed in the CEO panel. So we see the challenges as that there is the rapid changes in the systems, in healthcare systems across the whole world, with all these changes in the health ecosystem. Access to innovative health technologies are under so much pressure in these evolving countries. The increasing diversity of decision-making stakeholders, that there is no one-fits-all solution. That's why it's a very diverse part that you have to deal with all different types of decision makers and stakeholders. And then the pressure for the price transparency, the comparative effectiveness of your product versus the similar products coming from other competitors. The stubborn inflation that is happening in so many emerging countries, but also so many developed countries in the recent years. And the increasing competition from both local and also the global players is putting all these challenges onto the market, which makes the pharma need to have some ability to shape rather than react, right? So this is why this conference is so important. You need to be proactively shaping the ecosystem and shaping the whole industry rather than waiting and reacting to the market and its needs. The evidence-based pricing is something so important that we have seen this in so many other countries that we have been trying to support and help our clients to have better informed decisions and make better strategies. The more inclusive evidence generation and communication is definitely needed across the stakeholders, and the robust insights, which is why we have been saying that from insights to impact, this is how pharma needs to do this. So that means that there needs to be some actions that can help the pharma industry to succeed in among all these challenges and to be proactive rather than being reactive. The gaining the relevant insights into current and the future opportunities and challenges. The collecting the robust independent evidence across the range of the stakeholders. And then then it's also devising the trustable, implementable strategies to raise the full potential. So for this, I think what I would like to give a bit of just one quick slide in terms of how market access can provide a vast array of solutions to some key questions that might be responding to those challenges. So first of all, it's mainly about gaining insights and understanding the landscape.
Perfect.
Yes,
no
okay.
worries.
Thank you.
What's great, if you've got a...
So in terms of the landscape, what are the unmet needs? What is the competitive landscape look like? How is the expected likelihood of the reimbursement scheme? Is it a relevant reimbursement category for my product? And coming to the, how will payers view the technology that I'm providing? So are they ready to pay for this technology? And how this vary by market or by payer archetype, because there are various payer archetypes that we have seen. So I will be speaking about it just in terms of the 5 different archetypes in a minute. And what is the optimal go-to-market strategy for me? How can we be able to best address the best strategy, the potential barriers, and to overcome with those barriers? And what the data will be required to support my decisions? And coming to the next part, which is about how I can be able to show my value in terms of the story and messaging, because it's not only the product itself, it's not only the manufacturing itself, but it's also the messages and the value proposition that you are providing to the ones who would be going to register your product, who would be going to pay for your product. So that's why, what is the perceived value of your product versus the competitors? What messages resonates the most with your potential payers? Then how you can be able to resonate the best with those stakeholders? And also, if in terms of the launch, is there any sequence for launching my product in specifically this country first and then comes the next? Is there a sequence that has to happen? And if there is any pushback, what would be the biggest pushback on the pricing strategy from the payers that I have been trying to register my product or launch my product in a specific country and market? So these questions can be addressed through the research solutions, through the insight solutions, which might be focused around 4 pillars: the insight, evidence, value, and strategy. I'm not going through each of those because there are so many different research and insights types that can help you. So we can be able to discuss this later if you have been any interest in this later on. And when it comes to these 5 payer archetypes, we try to kind of summarize them, and then you might be able to see for your exportation or for your niche markets, which payer type having what kind of primary goal, let's say. So there might be a cost effectiveness, which is one of the archetypes, where assessing value through the improvement of clinical and economical outcomes. There might be another archetype, which is the comparative clinical effectiveness, which has been really looking for the comparative evidence of the clinical one. There might be patient as a payer, because in countries where, like Pakistan, out-of-pocket payment is one of the main payer types, that willingness to pay of the patient is something so important to take into consideration while launching a new product into the market. So that's why it's based on the different countries have varied payer requirements, that understanding the best fit to this geography in scope can be tailored through the market access solutions that can be done. So overall, to kind of wrap up, we see what the future holds and what might be the opportunities in the coming years. So we see that the future pricing assessments must factor the value attribution into consideration, the timely evidence that is like on time and that is reflecting the value, and with the HTA processes adapting to the uncertainty and the affordability. So to combine all of these is requiring that there needs to be a very careful planning by keeping all these into the consideration before going into a new territory and before launching your new products, and then increase your exportation to all those new countries and territories. So then I think finally I would like to just mention that, to summarize, we see opportunities in 2 sides. The opportunities for the industry and the opportunities for the, let's say, the authorities and the systems. For the companies, strengthening the supply chain resilience, which was also discussed in the morning. I think I'm a little bit of, okay. And because we know that the supply chain is also changing across the whole world. Accelerating the localization, but I think this is not applicable to Pakistan, where we see 90% of the total market is being provided by the local companies, which is an amazing achievement that I need to say. However, exploring the startup partnerships to maximize innovation, like adapting AI into the base of workings, would be something as an opportunity for the companies. Promoting sustainable and value-based pricing and procurement is definitely needed. exploring alternative pricing and funding models. This is, I think, one of the most crucial parts where like the public-private partnerships, like the public sector being more into and more initiating the things is also so important. Investments in regulatory and the market access capabilities of the whole country is also something very important. The digital transformation and leveraging AI is also quite important for the companies to utilize and maximize the potential and the opportunities for the next years of exportation for Pakistan in specific, let's say. For the health system, the opportunities are mainly the regulatory and the HTA harmonization, which is definitely needed for fostering the cross-border collaborations and learning from what others have done in neighboring countries or in some other countries where we see very successful exportation happening. So I think as a Turkish person, I'm so proud that we have one of our local companies, Abdi Ibrahim, which is so strong, not only in the country in Turkey, but also in terms of exporting to so many other countries with very successful brands and products. So branding is also something, if you really would like to achieve your cross-border, let's say, launches and accesses even further. The continued investment in the infrastructure and the labor and workforce is so important that I remember in the morning, again, like Dr. Mahmoud's discussion that we need to keep our young talents, be in the industry, grow in the industry, and we need this workforce for the full system to work in a better way. And the digital transformation and, of course, leveraging AI to transform the full healthcare ecosystem, not only the pharma companies spending efforts and time and investment on this, but also the full healthcare system, the authorities, the ministries also being and investing in this area to have better health outcomes and the kind of make it in a better way to have the full ecosystem, having better opportunities, and make this ambition of 7 to 800 million USD exportation to go up to 3, 4, even 5 billion. Thank you so much.
So informative. We love the data. My goodness me, the pharma sector are going to love data, let's be honest. I'm delighted to say that Pina has very kindly agreed, I hope you knew this, to take questions from the audience. We have roving microphones, so if anyone would like to raise their hand with a question for Pina, then we would be delighted to take it. If not, believe me, I can crack on with an awful lot of questions, but any thoughts on questions? I'm sort of roaming around. Do you know what I like to do in these situations is I always go a bit international. And of course, you've got that unique perspective across both Turkey and the UAE. And I just wonder which countries are a good model for what you've been describing. You know, I imagine there's elements of lots and lots rather than one country totally nailing it. But what would you suggest?
So I might be a little bit like biased in this, but I think like also Dr. Sami was kind of referring to this in his speech is that what we have seen in Turkey's healthcare ecosystem is quite integrated, that we have seen that as a patient or as a consumer, I can be able to like round around the whole country, go to any hospitals, have my treatment, and then another doctor, if I go and say that, you know what, this is what has happened in the past and this is how my story is evolved, that doctor can be able to access, if I give my consent, of all the history, which gives them the better perception and understanding of, as a patient, what's my history and story, so how they can help me with better access and with better things. And also coming to the country's pharma industry, I must say that we have some very strong local companies who have been like recognized very well in like, let's say, at least 50 to 60 countries, because it's not only that they have manufactured, but they have also become a branding companies that they have been exporting their brands across the borders. So I think Turkey would be a good, let's say, analog to search for.
Now, this might not be entirely your field, but I suppose that there are also questions around privacy when a patient is sharing their data across many hospitals and many doctors. I know that that's something that I had to get used to the idea of. In the UAE, I had to sign a document saying I was happy for it to be shared. In the United Kingdom, I had to share a document saying I was happy for that to be shared. Do you think the public minds that data being shared?
So there has been so many concerns and skepticism around the privacy, right? Around the patient privacy. However, at the same time, what we have been seeing with all these advancements in the technology, AI coming into the place, better healthcare, like kind of the robotic surgeries, and everything is happening is so fast. Yes, there are some concerns from both the healthcare professional sides and the patients. However, at the same time, we are seeing that the data being accumulated and being used for making better decisions is kind of, I think, giving the people the chance to kind of start looking from another angle that this is contributing to the better healthcare. So that's why this skepticism is there. However, at the same time, I think the governments and the authorities, the regulations also must respond to those skepticism and to those concerns that everything is being kept in full privacy. So that's why it's based on consent, but at the same time, it's also been based on the verifications coming from the government, coming from the authorities, that everything is being done in full privacy and there will be no issues with that, which will definitely evolve in time, which we have seen in so many preventive medicines like vaccines in today's world. In the past, it's been more skepticism that we have seen, but it's evolving because we know that sometimes we need those preventions. So this is exactly how this has been evolving, which we will be seeing in the society also. There is kind of a bit of a skepticism, but there is also hope for the improvement.
Any more questions for Pinar across the hall? I have my microphones at the ready. There's a gentleman here at the front. Ma'am, there's a gentleman here. Thank you very much indeed, sir. The microphone is on its way to you. Thank you, Pinar, for your time.
Thank you.
Thank you very much for a very brilliant presentation. Really, we all appreciate well. And thank you for adding up with the good questions for further elaborating that. My point of view, maybe for making such strategies, for especially for the pharma companies, probably addition to your presentation regarding the status of the universal health coverage and the insurance system would be more beneficial for making the strategies.
Yes. I think this is something that we haven't been discussed so much in my presentation as well, because I know that Pakistan is more of an out-of-pocket where there is no kind of, I think, established health insurance system. However, in so many countries, we have seen that the health coverage, the national health coverage, has been influencing and also impacting the full ecosystem in a way where everyone can be able to have much better access to healthcare facilities and to better healthcare. So I think I can tell this as a Turkish citizen that in Turkey, I have a privilege to go and visit any hospital at any time without paying big amounts to my medicines or to the things, but because of the system, the ecosystem is being and has been worked around this for so many years. It's not an easy journey. It has never been an easy journey. It has been the big collaboration between public and private. So that's why the public-private partnerships, I think, has been one of the key terminologies that we should be focusing and emphasizing more and more, because these partnerships would be leading to much better access for the patients, to better medicines, to better health managements. And the reimbursements, there are so many different reimbursement schemes, by the way. It's not only one way of reimbursement or one way of coverage. So that's why there are so many different versions or schemes around the nearby countries, in Central Eastern Asia, in some other countries, that might be something that can be put in front and trying to see how in Pakistan the full ecosystem, the industry, the private and public can come together and have the partnerships for this one. This is how personally I see this from as a person who have spent so many years in Turkey and in the industry.
Any more questions for Pinar? Looking around the hall, quick glance, any more questions? I'm going to ask one final question of you, if that's okay, because I'm interested in this idea of this data being shared across borders. And obviously, you work across borders, so you've probably sort of witnessed the various different permutations. Do you think that countries are prepared to share this proprietary data? Because, of course, everyone's competing in the pharmaceutical sector, you know, to produce drugs as fast as they can, you know, within the regulatory framework. Do you think that it might be that Pakistan, for example, would be able to borrow data for their research purposes from other countries, or do you think people are still a bit, countries are still a bit like, no, that's our population's information?
So I think I don't have an answer for this question from the research company perspective. However, from my personal point of view,
thank you for pausing, actually, Pinar, because we just a very important gentleman has just entered the room, and we're very, very grateful to Jam Kamal Khan, who is Federal Minister for Commerce, for arriving and joining us. He's just going to take a seat, and in the next few minutes we are going to be hearing from Jam. Pinar, in the meantime, yeah, please do. We have another minute with you, so I'd love to hear your answer.
Sure.
Thank you, sir.
Welcome.
No, thank you for coming, sir. It's an absolute pleasure to have you join us. And in the next minute or so, we will be coming to you, if that's right. I'll let you get comfortable first, though, sir. So yes, do you think countries are willing to share this type of data?
so I think based on all the challenges that we have discussed, all the pressures on the industries across the board, I do not see this as so easily to happen.
Yeah.
But still there has been some ways to kind of go and see how or what has been done in some other countries that has been so successful in doing this. And it can be kind of an inspiration, even if they do not exactly ready to share.
Yeah.
But still, it might be an inspiration from what has been done. Taking some analogs as an example, why not?
Pinar, it's been an absolute pleasure. Thank you very much for joining me in this slightly extended Q&A. I really, really appreciate your time, and your insights during your presentation were also completely fascinating. I'm sure you'd all like to join me in a round of applause for Pinar. Thank you very much indeed.
Thank you so much.
For your time. Amazing. Thank you. I'll grab that from you. Thank you. Right, my goodness me. Something of a crescendo ahead of our lunch break, and once again I would like to formally welcome our very distinguished guest, Jam Kamal Khan, Federal Minister for Commerce. We're very grateful for his attendance. We're very grateful for his arrival. And in the next few minutes, a whole new element is going to be rolled out, starting with a really interesting video, which I'm about to introduce, which is on the state of the pharmaceutical sector right here in Pakistan, and of course the export element of that. Yes, if everyone could take a seat, we're gonna roll the video. This makes me feel like a sort of a Hollywood screen director. But we are now going to roll the documentary on Pakistan's pharmaceutical export industry. Thank you.
कर्ज का बोझ पहाड़ बनने लगा है, मईशत की कमर टूटने का खदशा है।
भारी कर्जे पाकिस्तान की मईशत के लिए संकीन खतरा बन गए।
एक और बड़ा मुतालबा सामने आ गया, कर्जों पर सूद मईशत पर भारी बोझ करार दे दिया गया।
Pakistan's economy is sinking. It has no option but to seek a bailout.
हुकूमत किसी की भी हो, लेकिन उसे IMF के दर पर हाजिरी जरूर देनी पड़ती है। इसीलिए हम 76 सालों में 24 बार IMF के पास जा चुके हैं। जी हाँ, ये एक रिकॉर्ड है, मरज़ है कि बढ़ता चला जा रहा है। आज हम बात करेंगे एक ऐसे सेक्टर की जो पाकिस्तानी मईशत का इलाज कर सकता है। ये हैं बरतानवी चीफ इकोनॉमिस्ट अदनान खान। कुछ दिन पहले इन्हें वजीर आजम की इकोनॉमिक एडवाइजरी टीम का मेंबर भी बनाया गया था। ये कहते हैं कि देयर इज नो केस इन हिस्ट्री वेयर आउटसाइड एक्टर्स हैव कम एंड ट्रांसफॉर्म द कंट्री, एंड दैट इज ऑल्सो ट्रू फॉर पाकिस्तान।
2 बिलियन के लिए या 3 बिलियन के लिए अगर हम IMF के पास जा रहे हैं तो मेरा ख्याल है ये फार्मा इंडस्ट्री आपको 2-3 बिलियन अगले 3-4 साल में ऐड कर सकती हो।
And the numbers are easy to achieve because we have a potential in a pharmaceutical sector, nutraceutical sector, even in veterinary also.
आज 30 बिलियन की अगर एक्सपोर्ट है तो जैसे जो माहिर हैं एक्सपोर्ट के वो कहते हैं कि 100 बिलियन इज नॉट डिफिकल्ट टास्क।
If we can export our textile sectors around the world, why not pharmaceuticals? We have a potential and we can do it.
सख्त हालात और महंगाई के बावजूद फार्मा सेक्टर पिछले 10 सालों से हर साल डबल डिजिट ग्रोथ दिखा रहा है और उम्मीद है कि साल के आखिर तक इस सेक्टर का साइज 1 ट्रिलियन से भी तजावुज कर जाएगा।
Biggest challenges that this industry has in Pakistan is to fight the high levels of inflation, the high devaluation of the Pakistani rupee that has happened in the recent years, and of course the continuous increase in cost of doing business, whether it is due to the high bank markup rates or it is due to the high cost of labor.
इस वक्त फार्मा सेक्टर 2.5 लाख पाकिस्तानियों को रोजगार की बेहतरीन सहूलियात तो फराहम कर ही रहा है।
That it is the largest employer of graduates because we need the technical staff in the quality control departments and the production departments. So we are looking for graduates. They might be pharmacy graduates, chemistry graduates, microbiology graduates. So that's a big advantage.
लेकिन साथ साथ 22 करोड़ पाकिस्तानियों को खित्ते की सस्ती तरीन मेडिसिन भी मुहैया कर रहा है।
रीजन में सबसे सस्ती दवाइयाँ पाकिस्तान में दवाइयाँ मिलती हैं। इसका हमने कंपैरेटिव स्टडी इंडिया से किया तो 66% पाकिस्तान की दवाइयाँ ब्रांड टू ब्रांड, एप्पल टू एप्पल पाकिस्तान में सस्ती हैं इंडिया से।
यही नहीं, फार्मा कंपनीज पिछले 10 सालों में पाकिस्तानी मईशत को $20 अरब से ज्यादा का फायदा पहुंचा चुकी हैं, जो आज तक पाकिस्तान को IMF से मिलने वाले तमाम कर्जों से ज्यादा है।
फॉर एग्जाम्पल आज जो पाकिस्तान की फार्मा इंडस्ट्री वो $3 बिलियन की अप्रॉक्सीमेटली प्लस माइनस। अब अंदाज़ा करेंगे अगर ये $3 बिलियन अगर लोकल इंडस्ट्री प्रोवाइड नहीं कर रही होती तो आप उसका 3 गुना या 4 गुना इससे ज़्यादा आपको ज़रा मुबादला खर्च करना पड़ता है इसको अवेलेबल कराने के लिए।
हम अक्सर बांग्लादेश की एक्सपोर्ट सक्सेस स्टोरी की तारीफ करते हैं, लेकिन ओवरऑल एक्सपोर्ट्स में बांग्लादेश से कहीं पीछे रह जाने वाले पाकिस्तान का फार्मा सेक्टर बांग्लादेश के मुकाबले में 2 गुना ज्यादा एक्सपोर्ट कर रहा है।
कुछ कंपनीज ऑलरेडी इंटरनेशनल सर्टिफिकेशन हासिल कर रही हैं। उस सर्टिफिकेशन की वजह से उनको बहुत पजीराई मिल रही है इंटरनेशनल ममालिक में, और जिन कंपनीज ने ये इंटरनेशनल सर्टिफिकेशन ली है वो अपने बलबूते पे ली है। उसमें हुकूमत की कोई इन्वेस्टमेंट नहीं है, ना कोई डॉलर वैल्यू की इन्वेस्टमेंट है।
लेकिन अब जो तजावीज़ हम आपके सामने रखने जा रहे हैं उन पर अमल करके हम मईशत को 5 से 7 अरब डॉलर्स का सालाना फ़ायदा पहुंचा सकते हैं।
गवर्नमेंट से बहुत ज़्यादा चीज़ें नहीं चाहते हैं। 3 चीज़ें एक बेसिक होनी चाहिए। हैंड होल्ड कर लें इंडस्ट्री को। हुकूमत के अपने लेवल्स पे गवर्नमेंट टू गवर्नमेंट बहुत सारी डिस्कशंस होती हैं। स्टेट लेवल पे जब ट्रेड एग्रीमेंट्स होते हैं या ट्रेड डिस्कशंस होते हैं तो उसमें फार्मा इंडस्ट्री को मेरा ख्याल है टॉप प्रायोरिटी पे रखना चाहिए
we are asking to deal with this industry in the same way as it is being dealt in our neighboring countries or in the developing countries.
इंडिया का सक्सेस मॉडल 25 साल 30 साल पहले कोई इतनी एक्सपोर्ट नहीं थी. फार्मा एक्सचेंज, फार्मास्यूटिकल एक्सपोर्ट काउंसिल, फार्मा एक्सचेंज जिसको वो कहते हैं, बनाई. आज $25 बिलियन की एक्सपोर्ट हो गई उनकी. तो हम कह रहे थे भाई डोंट रीइन्वेंट द व्हील. डिसीजन मेकिंग सिर्फ एक बॉडी के पास हो कि फार्मास्यूटिकल एक्सपोर्ट की, वन विंडो. इंडिपेंडेंट फार्मास्यूटिकल एक्सपोर्ट काउंसिल जिसमें तमाम फंक्शन इवन फाइनेंशियल उस बॉडी के पास होने चाहिए.
जो डॉलर रिटेंशन है उसको कम से कम 35% कर दें ताकि जो एक्सपेंसेस है वो मीट कर सकें, और उससे फिर हम इन्वेस्टमेंट बढ़ाएंगे तो जाहिर बात उसका रिटर्न भी इंशाल्लाह इंडस्ट्री को मिलेगा, जिससे एक्सपोर्ट बढ़ेगी.
ये हमारा घर है, हमारे आबाओ अजदाद का मदफन और हमारी आने वाली नस्लों का मुस्तकबिल सब यही है. अगर हम खुद इसके लिए काम नहीं करेंगे तो फिर कौन करेगा? लेट्स हील पाकिस्तान, लेट्स बिल्ड पाकिस्तान.
Thank you very much. Bismillahirrahmanirrahim. मेरा नाम हारून कासिम है and I am the co-chair of this organizing committee of this summit. I am delighted and honored that our Commerce Minister, Mr. Jam Saab, is here, and it's my honor to request him for his remarks on this summit, as well as on the video we just did for the government and for our industry part. Jamal Saab, please, I request for your remarks on this event. Thank you, Jamal Saab. Thank you, sir.
Bismillahirrahmanirrahim. Honorable esteemed guests of pharmaceutical industry, delegates from other countries, ladies and gentlemen, Assalamu alaikum. Well, I normally do this whenever I have a written speech. Somehow, by seeing the audience, it at times just makes me not read it and address the audience face to face, eye to eye. And I'm just coming from NDU University, and where I had a small interaction with a workshop. And more or less, we were discussing about how the overall economic health of Pakistan economy and other industries is. Well, first of all, I would like to congratulate for really putting up a very nice gathering, a very intellectual gathering, a gathering which can definitely facilitate people in understanding in the industry more, and especially people like us, who are the main stakeholders, regulators, and the decision makers. So I'm very much pleased to be here, ladies and gentlemen, and it's an opportunity to really be here and learn from you all, and I'm very delighted to see this video also. Which definitely is showing the health of our country, the health of our economic situation, and nothing can really improve illness without a proper medication. So not only you people are doing a great job in giving health to people, but your overall contribution is one of the key factors which I also agree is going to contribute in Pakistan's overall growth, Pakistan's potential, and Pakistan's ability to capture a market which still we have not yet done. You know, it's somehow whenever you're in an environment, you just try to relate the subject and the terminologies accordingly also. And the diagnosis that I think which we do require is very important in Pakistan. And without any proper diagnosis, the solutions can at times do a fluke, but majority, in most cases, the cure is never taken place without a proper dialysis, a proper diagnosis and analysis of a situation of anything, whether it be a health of an individual or a health of your country or your industry or anything. I feel Pakistan for the last many years has only focused certain sectors for growth only. And the concentration of those sectors have limited our policy to be around as a subsidiary, as a savior, as an assistance to only those industries. I guess this all must have started from the agriculture crop of cotton that we had. So everything had to revolve around cotton, whether it's process, it's labor, it's value addition. And I would like to congratulate, it's not that I don't want to congratulate, I want to congratulate all the industrialists who have really put in their hard work in Pakistan in bringing the textile industry to a level which definitely gave us a pride in certain products, in value addition, in catering to the needs of our human resource, employment, services, and overall tax receipts to the government. But in all this, meanwhile, what we forgot, that with passage of time, how the economic growth took place from textile had to diversify. We had to channelize our focus, our policies to those sectors also, which were in the middle of coming and becoming more opportunities. But somehow, we could not see that, except for few areas, again, which gave us a little bit of more pride in terms of the sports goods from Sialkot. Sialkot really emerged as a new product after textile, leather and the sports good where people started to think Pakistan can also lead in other industries too. And same way, we saw how pharmaceutical and surgical goods were taking place. So this journey of expansion and diversification had to really take certain more opportunities in its fare also, and which I believe is the right time where now we are heading and seeing all those new opportunities which can really benefit Pakistan, as was stated in the video also. And that's my core belief also. I'm a very firm believer that every component, every segment, every sector in Pakistan has its own true potential which is yet to be exploited. And how to exactly know what that exploitation is, and how to exactly know what that potential of that product, that sector is yet to be identified, is yet to be explored and adventured. And that's one reason in the last government, when the creation of new councils were made, and I recently took a session with most of the councils and only 2 more are left, I had an opportunity of being with the pharma industry and the chemical industry and other industries also. And that was for the first time, being as a minister, any commerce minister had an opportunity to really listen what the market of that particular sector has to say. We do have government committees and a lot of platforms where the overall health of economy is discussed. But that health of an economy exists with many other components. As a whole, fine, addressing it makes difference. But I think so Pakistan needs to be very specific now. We need to be very specific and very specialized, like in medicine. It's not any more generalized. It's more specific and it's more specific. And if we go specifics, I think so there are a lot of opportunities we can really explore, we can invest in, and the whole global market is there to be one of its biggest buyers. And I'm very much delighted to see that one of the key industries that Pakistan has, in which we have expertise, we have know-how, we have knowledge, we have experience, and we know exactly how to that work as pharmaceutical industry. And that's why I very much believe that being as the Minister for Commerce, being as a member of the Parliament and the Cabinet member, the federal government now is wanting to see that diversified approach of addressing all the areas where we need to really focus in. Yes, after this post-budget, there are a lot of questions. There are big question marks, which the industry and many other industries do have, what the government has done and what the government is planning to do. I very much agree on certain things with the industry. It has been a very tough time for the industry to survive after the COVID. And right after the COVID, not exactly the pharmaceutical industry, which I think so benefited a little bit from COVID, but at the same time, there were other industries which really took the toll. So Pakistan's coming out from this overall pressure of not only local industry, but how to be an export-oriented market for the last 2-3 years have been very difficult. Those difficulties definitely had to be because of political reasons, economic reasons, our reserves, our inflation, cost of production, ease of business, and many other things which really made things tougher for the industry and the industrialist and business community. And still there are, it's not that things have really become very good in Pakistan, but we are trying our best. We're trying to, the last 6 months have been very challenging time for the government also, who definitely had to come up and come across all these challenges and slowly and gradually build up that confidence again. It's not an easy thing. To really build up a confidence is, I think so, one of the crucial things which we need to really build up in people's heart. Trust does miracles. And I'm a very firm believer that we need to relate and engage with our business community, meet them as much as we can, engage with their thoughts, listen from them, and give that space where they can really vent out, and then the government and the business community jointly put their effort in going forward and addressing all these challenges and bring Pakistan out of this whole economic issue and crisis. Ladies and gentlemen, you have, I think so, a very wonderful fraternity and a very keen depth of your industry. I would not like to take much of your time, but I would definitely like to, with the closing things, that this government is very much dedicated in not only addressing these issues, but trying to address them in the right manner. We do have a lot of rescue plans which any government brings in, but they're very short while and they're very short-sighted too. We need to develop long-term policies which first of all need to be sustainable. Policies which are not sustainable and their engagement with the international investment is not committed for longer period of time never creates a trust. And that trust is a question mark which is in the minds of people who are working in Pakistan and abroad. And that's the only key thing which really restricts people from coming in Pakistan and the investors to spend more in Pakistan. So our first goal is to really build up that confidence, overcome those impediments, and those impediments can only be fulfilled and covered once we do those right steps in the right manner and concrete steps. We saw a small relief when it comes to interest rate, to inflation, to the stock market rising a little bit, people's confidence, but at the same time, there's a very big issue of cost of production, which the industry is facing. I was glad to see today the finance ministry is really pushing hard on some of its schemes, like the SME sector of Exim Bank and the faster process of sales tax returns and many other returns which the government needs to do, and facilitation of EFS has been one of the key components. But however, at the same time, there are a lot of obligations, as you know all, that are international commitments for going to attain a global financial rescue plan is very crucial for Pakistan's health also. Once we do have that rescue plan, which again was mentioned in the video, it's not an ideal thing, but at the same time, the options are very limited too. I'm very much committed on this firm that we do have a lot of ideas, and there are a lot of plans which we have emotionally attached with us and we want to do for our country. But somehow it's going to take a little time in order to really make all these things channelized in a better way of producing, of really coming out and really taking us out from this whole mess that we are stuck in. Pakistan, like I always say, Pakistan's asset inventory is tremendous. That is one thing which we have. That's another question, that how we are dealing with it. But when it comes to our natural resource in any sector, whether it's be our human resource, whether it be our agro side, water, Pakistan natural resources and mineral needs and mining needs, metal needs of future, renewable, the marine blue economy that we have, 80% of all these natural resources are still to be explored, still be exploited. A lot of value addition is still there to be added in all these sectors. We have not targeted yet regions which are not covered in our trade overall plan. So there is a margin of growth. There's a margin of growth in all sectors in Pakistan. And plus, like I said, nothing like a huge human resource that you have, which is still to be diverted and directed to a channel where they can really produce well for Pakistan. So in the end, I am once again very much thankful for giving me this opportunity to come and interact with you directly. Listen from you, listen from the key stake people who are of this industry. Commerce Ministry, like I said, we are all there. We are focusing these councils that we have, and I want to just shed a little bit of light on these councils, which I'm sure many of you are not aware of. Under the policy, we had made these 13 councils for different sectors, which is totally, the membership of all these councils are by the private sector. And Ministry of Commerce is just there to facilitate them. And when I witnessed being in these councils, I saw there's a huge gap in between the government and all those policies, recommendations taking place on a right platform, and that platform becoming a policy and then being implemented. So it was stuck to the first phase, where councils were meeting, making their reports for the last 2-3 years, but reports and reports and reports. So what I felt is, unless and until a minister is not part of it, and especially the Minister of Commerce, and it's not taken to a platform where a decision-making has to come from the Prime Minister, these councils will be sitting, and maybe with the passage of 2-3 years, will become redundant. So what is our plan for that? Like, we have 16 councils now, and we are planning of increase those councils too. Whatever those councils have been doing for the last 2 years, we're trying to compile all their reports, whatever they must have been, whatever has been achieved from it, and what has not been achieved. The post-budget scenario is totally different. What the post-budget scenario has created in Pakistan has to be reflected in the fresh report, which again is going to be in collaboration with the councils and the Ministry of Commerce. And then we have this National Export Development Board, which is headed by the Prime Minister himself. I think so this is one of the key boards which I feel is one of a very potential platform where things can change. Somehow in Pakistan, we do address industrial issues a lot, but all are addressed in wrong platforms. Places where finance is heading a committee, commerce is heading a committee, energy is heading a committee. The coherence in between ministries is very not united. There are a lot of differences, and every ministry tries to guard its own interest, but not realizing the interest is affecting the overall interest of the country and the industry also. This platform is the only platform which is headed by the Prime Minister, and the participants of this platform and the board are all the major federal ministers of commerce, industry, finance, State Bank, Chairman FBR, even the provinces. And anything coming in the agenda of this board will have the overall not only commitment, but ownership of the decision made in that board. So I believe that anything which is decided by this whole board is going to have an effect. Because if it's not implemented, it means the decision of a prime minister while addressing all stakeholders is not owned. So I very much believe that the first meeting of this board was done under the Prime Ministership, under the Prime Minister Shahbaz Sharif Saab. A lot of deliberations were taken. A lot of new members from the private sector are also participants in this and members. And we are trying to take all these councils which are made under the Commerce Ministry, make a proper secretariat for all of them so that where they are facilitated in human resource and other things. And finally, their recommendations reaching to the right platform and board for a decision and then implementing them. And let's hope if we are successful in the upcoming 2-3 months in this, I very much believe we will start addressing the issues in the right manner for the right solutions. So in the end, let's hope for, I would say, in making things better, not only for the industry, for our country, but the needs which are very much there from the future. Globalization is converting into not nationalizing, but nationalism. And this nationalism we are seeing in Europe, we are seeing this nationalism in US, in many parts of the world. So I think it's high time we do see how we secure ourselves within Pakistan's overall economic situation and how we secure ourselves for our industry in the region and globally. Thank you very much, ladies and gentlemen, for being patient. Allah Hafiz.
Sir, thank you very much indeed. Difficult times ahead, but the government is listening, in summary. And I'm delighted to welcome onto the stage Khaled Misbah, Chairman of the PPMA. Also, we have Isra Sharif and Kaiser Wahid, both important individuals from the Organising Committee and the PPMA, because we would like to give Jan Kamal Khan a memento as a gesture of our appreciation for him joining us right here at this 7th Pharma Summit. We're hugely grateful to his. A round of applause, yes please, for Jan Kamal Khan. Rousing words there. And just while we have a stage full, I'd like to welcome Dr. Dennis Hall onto the stage as well. We have a memento for Dennis Hall, if he'd like to join us, and Semi Kumuk as well. If you'd like to make your way to the stage as well, we will be awarding you mementos as well, so you can join this happy photograph. So Dennis Hall, if you'd like to join us, Semi Kumuk as well, Pinar, if you'd like to come onto the stage, and Osman Khalid Wahid, just while we can share this moment of having lots of people on the stage, we might as well embrace the photographic opportunity and thank our esteemed guests by giving them a memento of this important day. Certainly an exciting event, certainly an informative event, and certainly one where we have really seen the collaborative enthusiasm, the collaborative efforts of the entire pharmaceutical sector right here in Pakistan pull together. Really wonderful to have so many important individuals joining us on stage. Now, I will ask if we could just do a few official photographs where people form a group picture. Yes. Ladies and gentlemen, I know that we are very keen to have a group photograph. Our esteemed members of the press here are enthusiastic for that. I know, at some stage we will. It's because we've got our federal minister on the stage. So here we go. If we could have a picture of the mementos, that would be absolutely delightful, sir. Yes, we do. So we have Dennis Hall on stage here. He's ready for the memento. Dennis Hall, here we go, sir. Thank you very much indeed. I'm not sure where you'll make your. There we go. Thank you very much indeed. Mr. Hall, if you'd like to stand next to the Minister for the photograph, that would be wonderful. Thank you very much. And then Semi, have we got Semi Kumuk, if you'd like to join us as well? Maybe Semi has... Oh, let me move out of the way. There we go. And then we will have Pinar and obviously Osman as well. Thank you. Pinar's, yes, let's see if we can dive in. Have we got Pinar's award? Here we go. Pinar. That's for Pinar. Thank you very much indeed. And then Semi Kumluk, are you on hand? We'd love to give you a memento. It might be that he's slipped out. He's missing the moment. And then, of course, Osman Khalid Wahid is our next. Do we have an award for Osman, or is it already on stage? And then we have a couple of exhibitors as well. So if Thursal and Delta, who are, you know, our valued exhibitors, would like to join us on stage, that would be wonderful. Thank you very much indeed. So we've got an award for Thursal and an award, a memento for Delta as well. Hello there, sir. Are you Thursal? Thank you very much indeed. Let me find your memento. It's just coming towards us now. I can see it approaching. There we go. Thank you very much. There we go. Thank you so much, sir. Thank you. And then Delta. Do we have a representative from Delta heading towards the stage? One of our key exhibitors? Wonderful. Thank you. That would be for our representative from Delta, but I think we're attending his company. Right then, so may I request a photograph of all our speakers with the minister, please? Sorry, sir, we are prevailing upon you in a big way. So all of our speakers, and those in the organising committee, if you'd like to draw together for the photograph, and so if you're part of the PPMA, or if you're on the organising committee, or you're one of our speakers, if you would be kind enough to join us. Thank you very much indeed. And do all gather in so we can have a nice photograph. I know it's always difficult to draw people together. Mr. Sharoon Qasim, please, sir. Well, the only person we haven't received is from Delta so far. Delta. And I think that's it for now. Delta hadn't arrived. Thank you very much indeed. Our photographers seem happy, we seem happy. Thank you very much indeed. Right, we are drawing very quickly towards lunch, but I would first like to welcome Zahid Saeed, who is former chairman of the PPMA, for a few closing words, because of course we have actually reached almost the end of this summit element of our day, ending with a bang. This afternoon, of course, we are going to be hosting the PESA 2024 Export Awards. And I know that most of you will be staying for that prestigious ceremony, but yes, the time has come for us to draw this summit stage of the event to a close. I'm sure you will want to join me now in a round of applause to thank the organising committee for a brilliantly organised morning summit. Thank you, of course, to our presenting partner, Hilton Pharma, our platinum partners, Medisure, OBS, and Farm Evo, and all of our other essential valued sponsors. I am now delighted, this is always my favourite part of the day, I'm delighted to now advise you to proceed outdoors or outside the hall for a delicious lunch. And we will see you here in an hour. Thank you very much indeed, ladies and gentlemen. Lunch is served.
Ladies and gentlemen, we have the Honorable Senate Chairman of Pakistan, Syed Yusuf Raza Gilani Sahab. We welcome him. हम शुक्रिया अदा करते हैं यूसुफ रज़ा गिलानी साहब का टाइम की पाबंदी का। मैं हमारे मीडिया के साथियों से गुजारिश करूंगा कि प्लीज़ आप स्टेज क्लियर कर दें ताकि हम अवार्ड सेरेमनी शुरू कर दें। हमारी देरीना रिक्वेस्ट होगी कि प्लीज़ जितने भी फ़ोटोग्राफ़र्स हैं वो फ्रंट लाइन प्लीज़ छोड़ दें और स्टेज क्लियर कर दें, क्योंकि फ़ोटोग्राफ़र यहाँ मौजूद है और सबको फ़ोटोग्राफ मिल जाएंगी। वी वांट टू हैव अ रिस्पेक्टेबल अवार्ड डिस्ट्रीब्यूशन सेरेमनी, तो हमारी कोशिश होगी कि हम और हमारे साथ सेनेट ऑनरेबल सेनेट चेयरमैन इज़ हियर अंटिल 4:30, तो आपको मौका मिलेगा तस्वीरों लेने के लिए। मेरी गुजारिश होगी कैमरामैन से प्लीज़ आप क्लियर कर दें स्टेज so we can begin the program. Thank you very much. Thank you, Honorable Senate Chairman. I give the stage to our host, Georgia. Thank you.
Thank you very much indeed. And thank you there, sir, for helping me with the photographers. I have a feeling that I might not have been listened to. Ladies and gentlemen, I really hope you enjoyed your lunch break. Welcome back to this very busy afternoon that we have ahead of us. There is a celebratory mood in the house, though, because it is time for the PISA 2024 Export Awards. And I know, sir, that you have been welcomed already, but it does fall to me as well to thank you so much for attending. We are in the company of Honourable Mr. Yusuf Raza Gilani. He is, of course, Chairman of the Senate of Pakistan. We are very honoured to have you here, sir, so thank you very much indeed for your time. Now, we're going to kick off proceedings with a short video that some of you might have seen before. It does really clarify the current state of the pharmaceutical industry right here in Pakistan. And this is when I get to act a little bit like a Hollywood director and I can say, roll the video, please.
कर्ज का बोझ पहाड़ बनने लगा है, मईशत की कमर टूटने का खदशा है।
भारी कर्जे पाकिस्तान की मईशत के लिए संगीन खतरा बन गए।
एक और बड़ा मुतालिबा सामने आ गया, कर्जों पर सूद मईशत पर भारी बोझ करार दे दिया गया।
Pakistan's economy is sinking. It has no option but to seek a bailout.
हुकूमत किसी की भी हो, लेकिन उसे IMF के दर पर हाजिरी जरूर देनी पड़ती है। इसीलिए हम 76 सालों में 24 बार IMF के पास जा चुके हैं। जी हाँ, ये एक रिकॉर्ड है, मरज़ है कि बढ़ता चला जा रहा है। आज हम बात करेंगे एक ऐसे सेक्टर की जो पाकिस्तानी मईशत का इलाज कर सकता है। ये हैं बरतानवी चीफ इकोनॉमिस्ट अदनान खान। कुछ दिन पहले इन्हें वजीर आज़म की इकोनॉमिक एडवाइजरी टीम का मेंबर भी बनाया गया था। ये कहते हैं कि देयर इज़ नो केस इन हिस्ट्री वेयर आउटसाइड एक्टर्स हैव कम एंड ट्रांसफॉर्म द कंट्री, एंड दैट इज़ ऑल्सो ट्रू फॉर पाकिस्तान।
2 बिलियन के लिए या 3 बिलियन के लिए अगर हम IMF के पास जा रहे हैं तो मेरा ख्याल है ये फार्मा इंडस्ट्री आपको 2-3 बिलियन अगले 3-4 साल में ऐड कर सकती हो।
And the numbers are easy to achieve because we have a potential in the pharmaceutical sector, nutraceutical sector, even in veterinary also.
आज 30 बिलियन की अगर एक्सपोर्ट है तो जैसे जो माहिर हैं एक्सपोर्ट के वो कहते हैं कि 100 बिलियन इज़ नॉट डिफिकल्ट टास्क.
If we can export our textile sectors around the world, why not pharmaceuticals? We have a potential and we can do it.
सख्त हालात और महंगाई के बावजूद फार्मा सेक्टर पिछले 10 सालों से हर साल डबल डिजिट ग्रोथ दिखा रहा है और उम्मीद है कि साल के आखिर तक इस सेक्टर का साइज 1 ट्रिलियन से भी तजावुज कर जाएगा.
Biggest challenges that this industry has in Pakistan is to fight the high levels of inflation, the high devaluation of the Pakistani rupee that has happened in the recent years, and of course the continuous increase in cost of doing business, whether it is due to the high bank markup rates or it is due to the high cost of labor.
इस वक्त फार्मा सेक्टर 2.5 लाख पाकिस्तानियों को रोजगार की बेहतरीन सहूलियात तो फराहम कर ही रहा है.
That it is the largest employer of graduates. Because we need the technical staff in the quality control departments and the production departments, so we are looking for graduates. They might be pharmacy graduates, chemistry graduates, microbiology graduates. So that's a big advantage.
लेकिन साथ साथ 22 करोड़ पाकिस्तानियों को खित्ते की सस्ती तरीन मेडिसिन भी मुहैया कर रहा है.
रीजन में सबसे सस्ती दवाइयाँ पाकिस्तान में दवाइयाँ मिलती हैं. इसका हमने कंपैरेटिव स्टडी इंडिया से किया तो 66% पाकिस्तान की दवाइयाँ ब्रांड टू ब्रांड, एप्पल टू एप्पल पाकिस्तान में सस्ती है इंडिया से.
यही नहीं, फार्मा कंपनीज पिछले 10 सालों में पाकिस्तानी मईशत को 20 अरब डॉलर से ज्यादा का फायदा पहुंचा चुकी हैं, जो आज तक पाकिस्तान को IMF से मिलने वाले तमाम कर्जों से ज्यादा है.
फॉर एग्जांपल आज जो पाकिस्तान की फार्मा इंडस्ट्री वो $3 बिलियन की अप्रॉक्सीमेटली प्लस माइनस. अब अंदाज़ा करेंगे अगर ये $3 बिलियन अगर लोकल इंडस्ट्री प्रोवाइड नहीं कर रही होती तो आप उसका 3 गुना या 4 गुना इससे ज़्यादा आपको ज़रा मुबादला खर्च करना पड़ता है इसको अवेलेबल कराने के लिए.
हम अक्सर बांग्लादेश की एक्सपोर्ट सक्सेस स्टोरी की तारीफ करते हैं, लेकिन ओवरऑल एक्सपोर्ट्स में बांग्लादेश से कहीं पीछे रह जाने वाले पाकिस्तान का फार्मा सेक्टर बांग्लादेश के मुकाबले में 2 गुना ज़्यादा एक्सपोर्ट कर रहा है.
कुछ कंपनीज ऑलरेडी इंटरनेशनल सर्टिफिकेशन हासिल कर रही हैं. उस सर्टिफिकेशन की वजह से उनको बहुत पजीराई मिल रही है इंटरनेशनल ममालिक में. और जिन कंपनी ने ये इंटरनेशनल सर्टिफिकेशन ली है वो अपने बलबूते पे ली है. उसमें हुकूमत की कोई इन्वेस्टमेंट नहीं है, ना कोई डॉलर वैल्यू की इन्वेस्टमेंट है.
लेकिन अब जो तजावीज़ हम आपके सामने रखने जा रहे हैं उन पर अमल करके हम मईशत को 5 से 7 अरब डॉलर्स का सालाना फ़ायदा पहुंचा सकते हैं.
गवर्नमेंट से बहुत ज़्यादा चीज़ें नहीं चाहते हैं. 3 चीज़ें एक बेसिक होनी चाहिए. हैंड होल्ड कर लें इंडस्ट्री को. हुकूमत के अपने लेवल्स पे गवर्नमेंट टू गवर्नमेंट बहुत सारी डिस्कशंस होती हैं. स्टेट लेवल पे जब ट्रेड एग्रीमेंट्स होते हैं या ट्रेड डिस्कशंस होते हैं तो उसमें फार्मा इंडस्ट्री को मेरा ख्याल है टॉप प्रायोरिटी पे रखना चाहिए.
We are asking to deal with this industry in the same way as it is being dealt in our neighboring countries or in the developing countries.
इंडिया का सक्सेस मॉडल 25 साल 30 साल पहले कोई इतनी एक्सपोर्ट नहीं थी. फार्मा एक्सचेंज, फार्मास्यूटिकल एक्सपोर्ट काउंसिल, फार्मा एक्सचेंज जिसको वो कहते हैं, बनाई. आज $25 बिलियन की एक्सपोर्ट हो गई है उनकी. तो हम कह रहे थे भाई डोंट रीइन्वेंट द व्हील. डिसीजन मेकिंग सिर्फ एक बॉडी के पास हो कि फार्मास्यूटिकल एक्सपोर्ट की, वन विंडो. इंडिपेंडेंट फार्मास्यूटिकल एक्सपोर्ट काउंसिल जिसमें तमाम फंक्शन इवन फाइनेंशियल उस बॉडी के पास होने चाहिए.
जो डॉलर रिटेंशन है उसको कम से कम 35% कर दें ताकि जो एक्सपेंसेस है वो मीट कर सकें और उससे फिर हम इन्वेस्टमेंट बढ़ाएंगे तो जाहिर बात उसका रिटर्न भी इंशाल्लाह इंडस्ट्री को मिलेगा जिससे एक्सपोर्ट बढ़ेगी.
ये हमारा घर है, हमारे आबा व अजदाद का मदफन और हमारी आने वाली नस्लों का मुस्तकबिल सब यही है. अगर हम खुद इसके लिए काम नहीं करेंगे तो फिर कौन करेगा? लेट्स हील पाकिस्तान. Let's build Pakistan.
Yes, welcome back. And what a sort of a rousing video that is, a real sort of call to action that we've seen there. Now, Honourable Mr. Yusuf Giuliani, Chair of the Senate of Pakistan, accompanied by Mian Khalid Misbah, Chair of the PPMA. I'd like to welcome you to the stage, if possible, please, gentlemen. Thank you very much indeed. A round of applause, please. Thank you very much indeed. And also, we'd be delighted to welcome Dr. Kaiser Waheed, of course, Chairman of the Summit Organising Committee, Dr. Marwash Khan, who is Vice Chair of the PPMA, and Haroon Kasim, co-chair of the Summit Organising Committee. If you'd all like to join us on the stage, that would be fantastic. Also, Isra Sharif, if you could join us as well. As part of our, I suppose, panel of esteemed individuals who are going to be involved in the next stage of our event, which is, of course, a very prestigious awards ceremony. Mian Khalid Mismar, perhaps you would like to kick events off with a welcome address, sir. Sorry, sir. Sorry, sir. I'm so sorry. Oh, you'd like another guest on the stage? I'm so sorry.
Asad Shuja, sir, please, if you join us on stage.
Thank you so much for joining us. Thank you, sir. Please do have a seat. Thank you, sir. Sorry about that. Mina Khalid Misbah, the stage is yours, sir. Thank you very much. I'll stop interrupting you.
Thank you very much for the introduction. We are thankful to the Honorable Chairman, Syed Yusuf Zaghlani, former Prime Minister of Pakistan and former Speaker of the National Assembly and a former Federal Minister. Sir, it's a pleasure to have you here. With your wealth of experience in legislation and in the government circles, in the different roles that you have been assigned over the years and successfully conducted them, it's an honor to have you here. It adds a lot of value to this gathering. All of us here are from the pharmaceutical industry. And आपके यहाँ आने से एक जो confidence building होती है that the government and the parliament is taking this industry seriously. Because we are all working for Pakistan. We are all working for the improvement of the sector in Pakistan. The sector is doing a great job in providing, जिस तरह आपने वीडियो में भी देखा, one of the lowest price medicines in the world for the people of Pakistan. And the potential from the sector to grow in exports, in creating employment, job opportunities. And since it is a very well-documented sector, the taxation base, improvement in the taxation base, these are all some of the things that this sector can easily contribute to the national economy. In our previous sessions where Dr. Mukhtar Bharat Sahab was here and the Commerce Minister Jam Kamal Sahab was there, we touched on the various aspects and the theme of today's summit and the Pharma Export Awards. One of the reasons for having these summits is that we get international speakers from all over the world, and we are a great player that we have a excellent speaking guests here from abroad who shed light on the innovations in the industry, on the way forward, what Pakistan should look for, what Pakistan should be aware of, and how Pakistan can best explore the potential of this industry and contribute not only to the national economy but also to the national health. Sir, with your presence here and later on as you will be distributing the awards for the export achievements, we honor the top 50 exporters here for the simple reason that it is very important to encourage the sector. As you can see, it's a full house and people are very interested in this sector, how it may grow, how it may flourish under the current government. The current government has just come into, in a few months ago, come into formation, so we look forward to 5 years of continuous work. And with you at the helm of the affairs at the Senate of Pakistan, we are looking forward to a very important legislation, which is the amendment to the Drug Act 1976. As you are aware, the Drug Act 1976 came into being when the Pakistan People's Party was in government in 1976. But unfortunately, 48 saal ho gaye hain ji, in the last 48 years, there has been no innovation, no improvement in the Drug Act. At that time, it was a very valid law. But now, in today's world, जहाँ दुनिया ने innovation की है, ना सिर्फ हमारे हमसाया ममालिक ने बल्कि दुनिया के दूसरे ममालिक ने developing and developed countries, they have all updated their laws and regulation. And you as being the Chairman Senate, we look forward to your support once the time so comes. We have engaged with the different governments, the federal government, the provincial governments, including the Punjab government, at the SIFC also. They are all looking at this amendment, and for the last 6 months we have been working on this together with all of them to build consensus, so that it's a consensus document that everyone can support, because this is not just an issue of the pharma industry. We feel that it is an issue of national security. A sector like pharmaceutical is a backbone of the health sector in any country. Issues like when we face the COVID-19 pandemic, when we face unfortunate disasters like earthquakes or floods, it is the local domestic manufacturing industry that takes care of its own, takes care of the people of Pakistan. If we do not have the domestic manufacturing sector, which is saving over $3 billion in terms of import substitution, it will be very difficult for a country of a population of over 240 million to cater for the health demand through medicines by importing them, especially when we have the consistent crunch of the foreign currency and consistent issues of foreign exchange in this country. So with these words, it's going to be a big challenge for Pakistan in the coming months and years, of course, based on the economic situation. But we as the pharma industry, we as the private sector are fully engaged and fully geared up and fully encouraged that with the positive steps that we saw from the current government and the current parliament, and even before the caretaker government, because the same prime minister was in office, we saw encouraging signs from the federal ministers of that time, from the government of that time, and we are looking at similar signs right now. And these are encouraging signs that in spite of all the difficulties that we are facing in the economic side of the country, in spite of all the challenges that Pakistan is facing politically, internationally and domestically, this industry is one which we can assure you, we can vouch for it that it's geared up, it's ready to go into the international market, compete with our neighboring countries and bring much needed export revenue to Pakistan. Our target, as we have shared with the government, is to grow from the current exports of pharmaceutical drugs from Pakistan is $300 million and the entire therapeutic sector is $700 million. And our target is to cross $3 billion in 5 years. And with the upcoming improvement in the quality of the pharmaceutical industry in Pakistan by a way of certifications of PICS and World Health Organization, this is the first time in Pakistan's history that we have a number of plants which are recognized by these international institutions. And that will is paving the way for tremendous growth in this sector, in the export segment. Of course, at the same time, our prime responsibility remains, and we are very cognizant of the fact that this industry has repercussions on the day-to-day health of the entire population. So for keeping good high-quality medicines available in the market at the lowest possible prices, we are thankful to the current government that they decided to issue the policy of deregulation of the pricing of non-essential drugs, which is what the entire world is doing actually, and we are 10-15 years late actually. And supporting that initiative together with the Drug Act amendment and certain other initiatives that we are in discussion with. So we hope for your support and your guidance when it comes to your office and the very powerful institution that is the Senate of Pakistan. And we are once again very thankful for you to be here. And I would like once again to congratulate the organizing committee of PPMA who organized this wonderful event and all the participants and ladies and gentlemen who are here to make it a great success. Thank you, sir.
Thank you very much indeed, sir. And it has indeed been a huge success already. Anyone who was here this morning for the summit will have learned a huge amount. We had that wonderful sort of collaborative atmosphere this morning, and I'm sure that that is going to continue into this afternoon. Now, with an introduction to the PISA Awards, I'd like to welcome Haroon Kasim, or invite Haroon Kasim, co-chairman of the Summit Organising Committee, also Managing Director, of course, of Pharma Evo, to give his welcoming address as well. Thank you.
Bismillah ar-Rahman ar-Rahim. Our respected Honorable Yusuf Raza Gilani Sahab, the Senate Chairman, my respected brother, Chairman PPMA, Khalid Bhai, Senior Vice Chairman, Chaudhry Israr Sharif Sahab, Vice Chairperson Dr. Mahwish Khan, my dear brother Kaisar Bhai, and Asad Bhai to be on the stage with me. Yusuf Sahab, we had a very exciting session this morning. We had an array of knowledge sharing this morning. Dr. Mahmood Khan, the CEO of the Evolution Foundation Saudi Arabia, which is the second largest foundation in the world, spoke about how the pharma industry can leverage, collaborate, scale, and impact the local as well as the global marketplace. We were honored by the presence of Dr. Malik Mukhtar Bharat Saab, the coordinator of the Prime Minister on Health. He assured his full support to the challenges that the pharma industry is facing. Our respected Mr. Dennis Hall spoke about the transformation in the pharmaceutical manufacturing. I'm really thankful to the Dennis who specially flew all the way from US. He's representing USP, United States of Pharmacopoeia, and I take this opportunity to thank him and the USP who has helped the pharma industry extensively in going for the international certification. We had another speaker, Dr. Sami Kumulk, who is the top 50 thought leader and influencer in the artificial intelligence. He spoke about how artificial intelligence is reshaping the pharma industry. We had Pinar Ergun, who spoke about the leveraging the market research for the pharmaceutical growth. All these distinguished speakers from the global world shared the knowledge and the best practices which the local industry can utilize to scale and collaborate in the global markets. Respected Yusuf Raza Saab, what is PISA? PISA is Pharma Export and Summit Award. This is the third export award which, alhamdulillah, PPMA is doing. This is the 7th Pharma Summit which the PPMA is organizing. The PISA has a basic objective is to acknowledge the exceptional performance of our exporters of the pharma industry and also to motivate them to do more for Pakistan as well as bring more exports. I'm really thankful to my chairman who gave us the full hand to organize this summit, and I'm thankful to all the organizers, all my team members who really helped me to deliver this, the best exceptional conference this year as well. Thank you, ladies and gentlemen.
Thank you very much indeed, sir. Now, without further ado, we will start our awards ceremony because we do have a lot of amazing pharmaceutical companies, a lot of people that deserve to be celebrated today. Now, just as a little bit of housework, when you hear your company announced, please do come forward onto the stage. We will then have a group photograph with our esteemed guests, and then we'll ask you to depart the stage, and our next guest will arrive. Also, I'm just going to mention the photographer situation again, if at all possible. If we have one official photographer who I believe is going to stand near the front, and I've been told to be very strict otherwise. I'm not quite sure how I'm going to battle you to the ground, but you know what I mean. But yes, so let us start. Gentlemen, we're going to, I'll invite our first award to come to the stage, and our first winner is Getz Pharma Limited. Congratulations to Getz. And if our representative from Getz could make his or her way forward to the front of the stage, we can provide you with your award. There's a lot of movement in the room. I'm not sure whether any of the movement involves our representative. At present, I am not seeing you, so we're going to move on to Searle Company. Could we have our representative from Searle Company? Congratulations, a round of applause, please. Again, here we go. The gentleman from Searle is arriving. Thank you very much. Sir, if you come forward for a photograph, that would be absolutely lovely. Our next winner is Herbian, Pakistan. Congratulations. Please do make your way to the stage. Congratulations to Herbian. Herbian. There we go. Thank you very much indeed, sir. The representative from Herbian arriving now. Our next winner is Genix Pharma Limited. Congratulations to the team at Genix. Another fantastic performance this year.
Georgie, I would like you to please stop here. अच्छा ये दोबारा से रिक्वेस्ट की जा रही है ऑर्गेनाइजर्स की तरफ से तमाम कैमरामैन एक ऑफिशियल हाकिम सन्स के अलावा प्लीज़ इन दी ऑनर ऑफ द इवेंट आप लोग पीछे चले जाएं सिक्योरिटी काइंडली रिक्वेस्ट करें ये सारी तस्वीरें आपको मिल जाएंगी अभी लाइव मिल जाएंगी आप लोग प्लीज़ पीछे चले जाएं सारे फोटोग्राफर्स देखें पीछे चले जाइए प्लीज़ आपको सब तस्वीरें मिल जाएंगी आप प्लीज़ पीछे चले जाएं ठीक है सर तरक्की करेगा मुल्क
So our guest from Genix has arrived. Our next guest is, or I guess our next award winner is Sami Pharmaceuticals. Congratulations to Sami Pharmaceuticals. If you'd like to join us on the stage now, sir, an honored guest. Thank you very much indeed for your attendance. Thank you very much for your hard work in the pharmaceutical industry this year. And our next award goes to Nabi Qasim Industries. Thank you. Okay. God. Thank you. Thank you very much to the team from Nabi Qasim Industries. And our next winner is CCL Pharmaceuticals. Congratulations to the team from CCL Pharmaceuticals. If you could make your way to the stage, that would be fantastic. Congratulations, sir. And our next award winner is ATCO Laboratories Limited. Congratulations to the team at ATCO. Thank you very much indeed, sir, making your way to the stage for your official photographs with our dignitaries. And our next award winner is Martin Dow Marker Limited. Congratulations to the team at Marker Dow. Thank you, sir. And the next company that we are planning to recognize is Halion. Could the team from Halion make their way to the stage? Congratulations, gentlemen. And our next award winner is Farm Evo Limited. Congratulations to the team at Farm Evo. Do I see the team from Farm Evo approaching? If we don't, I am going to proceed and I'm going to congratulate the team from Hoist. If the team from Hoist would like to make their way to our stage, congratulations, sir, for your contribution to the pharmaceutical sector in Pakistan this year. Congratulations also go to AGP Limited. If the representative from AGP, the CEO or maybe the founder, could make his way to the stage, that would be fantastic. Welcome, sir. And our next award-winning company is High Noon Laboratories Limited. Congratulations to High Noon. I see their representative, their CEO or their founder is making their way to the stage now. Congratulations to you, sir. And congratulations also to Zafar Pharmaceutical Laboratories Limited. Congratulations to Zafar. Do I see a team member from Zafar approaching? Yes, I do. Welcome, sir, to the stage. And our next award winner is SciLife Pharma Limited. Congratulations to the team from SciLife. Hello there, sir. And another award winner this year in Pakistan is Pfizer. Congratulations to the team from Pfizer for your hard work this year. A round of applause. Yes, thank you very much indeed. And our next award winner this afternoon here at this 7th Pharma Summit is Ferrer's Sons. If we could welcome the team from Ferrer's Sons to the studio, well, to the stage. Once again, sir, thank you for your time. And Pharmatech Pakistan have also proven their worth, proven their salt this year. If the team from Pharmatech would like to make their way to the stage. Ma'am, gentlemen, thank you very much indeed. Lovely to have you both join us here for your official photograph. And if the team from Macta International Limited would like to join us on the stage next, we would love to give you your award. Thank you very much indeed, sir. Thank you for making your way. And congratulations now go to the team from Star Laboratories. Thank you very much for your contribution to the industry this year. Thank you very much indeed, sir. And our next winner is the team from Surge Laboratories. If you're from Surge Laboratories, sir, I can see you making your way towards us. Thank you very much indeed. And congratulations to you for your contribution to the pharma industry this year. And our next award winner is Joffman Pharmaceuticals. A round of applause, please, for Joffman Pharmaceuticals. Thank you very much indeed. Congratulations, sir, and welcome to the stage. And congratulations should also be afforded to Shaigan Pharmaceuticals. Shaigan Pharmaceuticals, if the team from Shaigan would like to join us, thank you very much indeed. So I can see perhaps more than one person making their way to the stage. That's perfect. Thank you very much indeed, gentlemen. Yes, and our next Pharma Export Award winner is Brooks Pharma. Congratulations for all your efforts this year in 2024. It's been a busy year. Fantastic to have you with us. Fantastic to gauge your contribution to the pharmaceutical sector in Pakistan. Thank you, sir. I'm sure you'd like to join me now in a round of applause for Saffron Pharmaceuticals for their contribution this year to the pharma trade. Thank you very much indeed to the team from Saffron. You can see me, there you go, sir. Thank you very much indeed. We have such a large hall of guests. Sometimes it's hard to find the person among the crowd. And our next award winner is Indus Pharma Limited. If the team from Indus would like to join us, a round of applause for them this afternoon. Thank you very much indeed. Hello there, sir. Congratulations, sir. And congratulations also to the team from Medisure Laboratories, based, of course, here in Pakistan. The team from Medisure, if you'd like to make your way, we would be delighted to have you join us on stage. There he is, sir. Thank you very much indeed. Popular award winner there. And our next team is from Biolabs. Yes, sir, thank you very much indeed. Welcome to our awards ceremony stage. It's such a great pleasure to have the team from Biolabs join us. A round of applause, please, for the team there. Further congratulations go to the team at Shazu Pharmaceutical Laboratories. Now, I know the team from Shazu are here because we were joined earlier. We had a discussion about the future of exports right here in Pakistan, and it was a great pleasure to speak to you on stage. Congratulations there to the team from Shazu. Of course, we're hugely grateful to our panel of esteemed guests for taking the time to award these trophies and also of course, to take part in these important photographs. Awards, the next award is going to Pharmedic Laboratories. Are the team from Pharmedic in attendance? Yes, indeed, sir. I can see you making your way towards us. Congratulations to you for your contribution to the pharmaceutical sector here in Pakistan. And our next award goes to the team from Remington Pharmaceuticals. Congratulations To the team from Remington, thank you very much indeed, sir. Welcome to our stage. Another key contributor there to the export market that we have here. Our next award winner is Stallion Pharmaceuticals. We're getting a real sense here of the scope of the companies right here in Pakistan. Thank you very much indeed to the team from Stallion for joining us at this special PISA Awards ceremony. Yes, and congratulations next go to Selmore Pharmaceutical. Congratulations to the team from Selmore. I can see the gentleman approaching us from afar. Here we go. That's lovely. Thank you very much indeed, sir. The hall is big. Thank you very much indeed there for the team from Selmore Pharmaceutical. And next we have the team from Sante, who I know are here. Thank you very much indeed, sir. Welcome to the stage. Lovely to see you again. There we go. Lovely group photograph there for the team from Sante, who have contributed so much to the event today as well. So huge thanks to them. Our next winner is Efros Chemical Industries Limited. The team from Efros making their way towards us now. Congratulations to you, sir, for your contribution this year. Thank you so much for joining us for a picture. Here we go. I'm going to move slightly to the left because I'm worried I'm in frame. Don't think you want a lurking presenter. Here we go. Congratulations to you, sir. We're now moving on to our next award winner, and huge congratulations and a round of applause, please, for Swiss Pharmaceutical. Thank you very much indeed. Welcome, sir. So many beautiful awards here. I don't know if you've noticed, but it's a bit like the Oscars. They're absolutely stunning awards, and we're very grateful to our panel of esteemed guests for taking the time to award them to our winners. Up next, Frontier Dextrose. Welcome to the stage. The team from Frontier, congratulations to you. So we'll proceed to our next award winner, who is Davis Pharmaceutical. Thank you very much indeed, sir. Lovely to have you join us on the stage. The team from Davis Pharmaceutical, congratulations. And our next award winner is Don Valley Pharmaceuticals. Would the team from Don Valley like to join us? And a round of applause for the team from Don Valley who are joining us now. Congratulations there to the team from Don Valley. Our next winner is Tabros Pharma. Congratulations to the team from Tabros Pharma. Thank you, sir. Right, our next award winner is the team from Bosch Pharmaceuticals. Welcome to the stage, sir. Gentlemen. Congratulations there to the team from Bosch. And also, congratulations go to our next award winner, Uniferros. Congratulations to the team from Uniferros. really lovely to see so many of our pharmaceutical experts gathered here in our hall today. Our next award winner is Wilshire Laboratories. Congratulations for your contribution to this sector. Thank you very much indeed, gentlemen. Do make your way. So I suppose the question is whether I'm allowed to show a preference for a pharmaceutical company as an English person. Probably not. I'm probably not allowed to do that. But our next award winner is English Pharmaceutical Industries, which I feel a strange bond to. I can't imagine why. So for the team from English Pharmaceuticals, welcome to the stage. Of course, a proud Pakistani company. Thank you very much indeed. And we are nearing the end, unbelievably, of our award ceremony now already, but we do have a few more really exceptional Pakistani companies to celebrate today. So I would ask you to put your hands together for our next award winner, Cotton Craft Limited. Congratulations. Please do join us on the stage, the team from Cotton Craft. I'm not sure, oh we do, sir, thank you very much indeed. Congratulations to the Cotton Craft team. I am delighted now to say that it is the turn of Opal Laboratories. The team from Opal, congratulations. Please do join us for a quick picture and, of course, the handing over of your award. Yes, congratulations there to the team from Opal. Our next award winner, the next company that we feel really deserves recognition is Pacific Pharmaceuticals. Welcome to the team, welcome to the stage. Thank you for your contribution. And do we have someone from Pacific making their way? If we don't, I will move to Nexus Pharma. Congratulations to the team from Nexus Pharma. Thank you, sir. Now with just 3 more companies to award, I'm going to encourage a celebratory mood within the hall. So I'd like a big round of applause, please, for our next winner, who is Pharmasol Limited. Round of applause, ladies and gentlemen. Thank you very much indeed. Congratulations to the team from Pharmasol. There we go. And with just 2 more winners to go, I wonder if the team from Wellmark Pharmaceuticals would like to prepare themselves to come forward, sir. Thank you very much indeed. Congratulations there to the team from Nexus. And then this is our gentleman from Pharmasol here. Thank you very, oh, from Wellmark, my apologies, sir. This is what happens when I reverse myself. Congratulations to you, sir. Wellmark Pharmaceuticals. And our final winner of the day, certainly the last but not the least. I would like to pause because it has been a really wonderful award ceremony. I know that everyone here deserves to be celebrated. There's been a huge amount of work into the pharmaceutical sector, not just this year, but in the last few years. We have one more, which is to Glitz Pharma. Glitz Pharma. To the team from Glitz Pharma, thank you very much indeed, sir. If you'd make your way to the stage for our final group photograph. And that does bring us to an end of our award ceremony. Congratulations all round. If I could have a big round of applause around the whole of our hall for all our winners. Thank you very much indeed. Now, I'm delighted to say that our chief guest, the Honourable Mr. Yusuf Raza Gilani, has agreed to address us. He is, of course, as you know, chairman of the Senate of Pakistan. And so I would be delighted if you were happy to you can either sit where you are or you could come to our podium. I think maybe the media would prefer the podium. But sir, if you could, this is your opportunity, sir, to address the pharmaceutical community. Thank you very much indeed.
Bismillahirrahmanirrahim. Mia Khalid Misbah, Chairman, PPMA. Harun Qasim, Chairman, Organizing Committee. Mia Asad Shuja, Chairman, Organizing Committee. Qausar Waheed Sheikh, Chairperson, Organizing Committee. Mia Misbah Rahman, former Chairman, PPMA. Chaudhry Israr Sharif, Senior Vice Chairman. Said Farooq Bukhari, former Chairman, PPMA. Mia Khalid Misbah Rahman, Chairman of the Pakistan Pharmaceutical Manufacturers Associations. Esteemed members of the association, respectable CEOs and executives from the pharmaceutical industry. Assalamu alaikum and a very, very good afternoon to you all. It is my profound pleasure to join you today, gathered here not to only acknowledge outstanding achievements, but also reaffirm our commitment to the advancement of this vital industry. The PPMA has been instrumental in enhancing Pakistan's pharmaceutical footprint, both domestically and globally. Its role during times of national crisis, including the COVID-19 pandemic, has also been exemplary. Your contributions to encourage a culture of excellence and innovation in the country are commendable. I'm very pleased to learn that more than 95% of our country's pharmaceutical needs are being met by local manufacturers. This is a remarkable achievement that deserves widespread recognition. These awards are more than just a celebration of success. They symbolize hard work, innovation, and resilience of the companies represented here. These companies are not just market leaders, but they are also torchbearers to our economic growth. Contributing significantly to our exports, they are showcasing the best Pakistani brilliance to the world. Ladies and gentlemen, the pharmaceutical sector is one of the key pillars of our economy. It is highly promising. The sector is expanding its reach into high-value markets such as Europe, the USA, and the emerging markets in Asia and Africa. However, I see enormous potential our pharma industry to boost export and size their due share to the global pharmaceutical market, which is projected to reach $2.5 trillion by 2029. In comparison to its regional counterparts, Pakistan's pharmaceutical industry is relatively smaller but showing reassuring growth. India, with its robust pharmaceutical sector, is global leader in generic drug manufacturing and exports, contributing significantly to the global market. In 2022, India's pharmaceutical exports were valued at over $24 billion. Pakistan, on the other hand, exported pharmaceutical products worth over $341 million during July 2023 to June 2024 period, as compared to the exports worth over $328 million during the corresponding period in 2023. This reflects a growth of 3.90%. This is a testament of pharma sector's progress, which is helping to position our country as a significant player in the global health market. Despite the smaller scale, Pakistan Pharmaceutical is expanding with local companies increasing capturing markets share from multinational corporations. Here, I deem it pertinent to highlight few key areas where our industry can strategically focus on increased exports and compete on a par with regional players in global market. Firstly, we must continue investing in innovation, building partnerships, and embracing digital transformation. The world is changing rapidly, and the pharmaceutical sector is no exception. We must leverage new technologies like telemedicine and digital health records. Secondly, we need to focus on expanding our research and development capabilities, improve regulatory frameworks, foster international collaborations with renowned peer companies, and strengthen public-private partnership to enhance our competitive edge. Another crucial front is investing in the production of generic drugs and biosimilars that can help Pakistan tap into growing global demand of affordable medications. By addressing these areas, Pakistan can bolster its pharmaceutical exports and strengthen its position in the global market. Ladies and gentlemen, as we celebrate achievements of our pharma industry today, we must also be mindful of the challenges that lie ahead. Global inflation and the resulting economic slowdown are some of the hurdles we face today. Another key challenge is posed by the fact that 98% of the active pharmaceutical ingredients for manufacturing drugs is imported. This adversely affects cost of medicines and also competitiveness of the industry in the international market. There is a dire need to check this crippling reliance on imported raw material if we want our pharma industry to truly thrive, realize its full potential. Using locally available minerals and herbs combined with indigenous manufacturing of synthetic material and biologics, we can make the transition to local production of raw material. This will not only help save precious foreign exchange reserves spent on expensive imports, but also bring down prices and boost exports. I look forward to hearing suggestions from the industry as to how the government and the parliament can support them in their regard. Ladies and gentlemen, today, as we honor top 50 exporters of pharmaceuticals and allied products, we recognize their valuable contribution to not just the industry, but Pakistan's broader economic landscape. As Chairman Senate, I assure you that we remain committed to fostering conducive environment that encourages investment and ensures that our industries remain competitive globally. The future of Pakistan pharmaceutical industry is bright. But to fully realize its potential, we must work together. And we have always proven our resilience and determination will see us through. In this regard, I strongly urge the stakeholders and authorities concerned, including the Drug Regulatory Authority of Pakistan, and to support and encourage pharmaceutical in making due contributions to economy and health care system. To the companies represented here, I encourage you to keep pushing boundaries and continue setting new standards of quality and innovation. In closing, I extend my heartfelt congratulations to all the award winners. Let us seize this occasion to reaffirm our commitment to excellence and to continue working toward a brighter, healthier, and more prosperous Pakistan. Thank you, and I hope your afternoon is filled with joy and motivation. Pakistan, Zindabad.
Thank you very much indeed. We could not be more grateful for those important words. The future is bright for the pharmaceutical sector right here in Pakistan indeed. Now, as we draw our proceedings to a close, I would like to just welcome another one of our esteemed organisers to take part and to approach the podium. Isra Sharif is Senior Vice Chairman for the Pakistan Pharmaceutical Manufacturers Association, also, of course, Managing Director and CEO of Genix Pharma. Sir, it falls to you to close proceedings.
Yeah, thank you very much. First of all, thank you, everybody. We have seen this since morning 9 a.m. till almost 4:20 now. So thank you very much, everybody coming here, and especially Glensa for your time and giving award for Pakistan Pharmaceutical for Export Award. This is Pakistan Pharma's 7th summit, and especially for export, this is the 3rd one. This gives us encouragement, especially a local pharmaceutical industry, to grow their businesses out of Pakistan also, to invest in that one. And I also especially like to thank Mahmood Saab, Khan Saab, you especially came all the way to Pakistan, and Dennis, you came all the way, all the speakers, all day was full of activity program. And we learned a lot of things about digital pharma, what we have to do for future, how the pharma industry going to change, what AI going to play the role in pharma industry. As all the CEOs and especially Dr. Bharat, he came in the morning and his speech also, that he wants to help a local industry. I think these kind of a session give us industry and the media to see how the local industry is working and how we can improve ourselves, how the local community can be helpful with the healthy medicine, with the quality medicine. And especially, I like to say thank you very much to Harun Qasim Bhai. Please stand up for that. What you have done is excellent. And I want everybody to please clap for Harun Bhai, as he has been busy for last 3 weeks only for working for this summit. And Kaisar Bhai, please, can you stand up for that? And Kaisar Bhai also worked hard for this also. This is a unity which show as a pharma. When we started this pharma, it's okay. When we started the pharma summit, this is the 7th one. It was very hard in the beginning. The challenges were there. But now you see the opportunities, people learn a lot, and the international speakers come to Pakistan. There's some speakers come to first time in the Pakistan, they see the opportunities. And the media, thank you very much for media also to giving us a coverage and which give us edge. Thank you very much. Pakistan, Zindabad.
Thank you very much indeed, sir. Now, we've just got a couple more things to do just before we do indeed close this event. First, I'd like to ask Mian Khaled Misbah, the chairman, of course, of the PPMA, to award our esteemed guest, the Honourable Mr. Yusuf Raza Gilani, chairman of the State of Pakistan, with a memento. Just a gesture of the huge amount of appreciation we all feel for his contribution today, and yes, one more opportunity for a group photograph. Congratulations, and yes, a round of applause. And I have to say, what a day. I really would like to congratulate all our winners today, all our participants, all our esteemed speakers, and of course, the organizers of this fantastic summit.
I take this liberty to request our honorable chief guest to please hand over the memento to our host for the whole day, Georgia Tolley. She came all the way from Dubai.
Oh,
so Georgia, it's a surprise for you.
This was very unexpected. Wow, gentlemen, I don't normally get to do this. Thank you very much indeed. Thank you.
She is the former BBC reporter as well.
Thank you. I really appreciate your time.
Thank
sir.
you, Georgia.
Thank you. Thank you. You can see I'm not used to being given awards, so that's very, very kind of you. Thank you very much indeed. I will continue with my job now, and I really do have to say thank you to all of you. I get to travel the world doing these types of events, and it is very exciting to see an industry making such strides. And I have to thank everybody, and I'm sure that our organisers will feel the same. An event can only be as good as its collaborators, and everyone here has collaborated to take part, and I think we all appreciate your time. I'd also, just like to thank our presenting partner, Hilton Pharma, our platinum partners, Medisure, BS, and Pharma. Oh, yes. Oh, yes, sorry, sir. Yes, go ahead.
Shafiq Abbasi Sahab, Aman Sheikh Sahab, please
I
kindly
think we're
join.
just suggesting a quick group photograph while we have everybody here.
Taqir Haq Sahab.
If you'd like to
we're
make
just
your
welcoming
way
the
to
new
the
team
stage.
after our elections and the AGM, the chairman, the new senior vice chairman and vice chairman. So they are from Lahore, Karachi and Islamabad, so they're representing all the three main cities. And also request the former chairman, Zaid Said Sahab, Mia Misbah Rahman Sahab, Farooq Bukhari Sahab, Saboor Sahab, please join us, ji. For a group photo on the stage, ji, please. Senator Bilal Mandokhil Sahab, please, sir, kindly.
Thank you, gentlemen, for making your way to the stage. A group picture.
Hamid Raza Sahab भी आगे हुए हैं, हमारे former chairman. Hamid Sahab, Hamid भाई किधर हैं? Here, Hamid Raza Sahab. Usman Khalid Wahid bhai, please, you have been an important part of this event. Without you, our chief speaker wouldn't have been here, as he said himself. I'm only here because of Usman, so we welcome Usman Shaukat Sahab, newly elected President of Rawalpindi Chamber of Commerce. Dr. Mahmood Sahab, please kindly join. Hamid bhai, I think he may have left you, please.
So one last group photograph of everybody who has played such an important role in this extraordinary 7th Pharma Summit. Thank you very much indeed, gentlemen. Pinar and Dan making their way. Our international speakers. And yes, that photograph, I will thank our presenting partners, Hilton Pharma, our platinum partners, Medisure OBS and Pharma Evo, and of course all our other essential valued sponsors, including those exhibitors outside the hall. It is clear, ladies and gentlemen, and you can see it on the stage now, that the future of pharma here in Pakistan is bright, to steal the phrase from Honourable Mr. Yusuf. And with events like this, pulling the community together, success and growth will surely follow. So for now, goodbye, but I hope to see you again, same place, same time, next year. Congratulations, everyone. Oh, thank you. I appreciate that. Look at that.
पाकिस्तान फार्मास्यूटिकल मैन्युफैक्चरिंग एसोसिएशन के जो मेंबरान हैं वो यहीं रहे. अभी एनुअल जनरल बॉडी मीटिंग के लिए जो मेंबरान हैं वो यहीं तशरीफ रखें. बाकी मेहमान हजरात चाय के लिए तशरीफ ले जाएं. एजीएम अभी शुरू होगी.